Chat's disabled.
Thank you, Joyce. And we are moving along. Okay, we are ready, Chair.
Okay. Good evening and welcome. My name is Jimmy Palmieri and I'm the chair of the West Hollywood Human Services Commission. I'd like to begin with the land acknowledgement. The West Hollywood Human Services Commission acknowledges that the land on which we gather and that is currently known as the City of West Hollywood is the occupied, unceded, seized territory of the Gabrielino Tongva and the Gabrielino Kizh peoples. In an effort to protect public health and prevent the spread of COVID-19 coronavirus, AB 361 has authorized public meetings to take place via teleconference because state and local officials are recommending measures to promote social distancing. To view the Human Services Commission meeting, please note that the Zoom platform is the official viewing platform for this meeting. To afford the public with an additional viewing option and in order to expand access to our public meetings, this meeting is also live streamed as a courtesy on YouTube at youtube.com/WehoTV. However, because YouTube is a third party and operates independently from the City of West Hollywood, the streaming reliability cannot be guaranteed. I'd like to call the meeting to order at 6:03 on July 26th. I didn't pick someone to say the Pledge of Allegiance, so Stephen, would you like to?
Everyone cross your heart with your hand. And you know, me, I pledge allegiance
Pledge allegiance
to the
flag
flag of the United States of America
and to the
and to the republic for which it stands,
one
one
nation,
nation,
Indivisible.
Visible.
visible, liberty and justice for most.
Thank you.
You're welcome.
Dee, will you be doing the roll call this evening?
Yes, Chair, I will.
Okay, great, thank you.
Commissioner Borelli,
Present.
Commissioner Byers,
Present.
Commissioner Darvish,
I'm here.
Commissioner Davis,
Here.
Commissioner Freiberg,
Here.
Vice Chair Meltzer,
Here.
and Chair Palmieri.
Here, thank
We
you.
have a quorum.
Thank you very much. 1C, approval of the agenda. Can I get a motion?
Mr. Chair, before I make a motion, I'd like to first ask staff before I ask fellow commissioners if it's possible to move item 4A to our next meeting.
David, would you like me to answer that, or do you want to?
We've been asked, Commissioner Borelli, to have this item on this evening's agenda. The Long-Range Planning and Mobility Department would like to get input from the Human Services Commission. There's an update that's going to be going to council in September. And specifically, I suggested that they receive input from the Senior Advisory Board, the Disability Advisory Board, and the Human Services Commission. So we'd very much like to be able to leave it on the agenda tonight. It is a brief presentation. It seems as though we would have time. We potentially, and Paige is the staff who's here from the city to present. I think potentially it could go in August, but there's just quite a few other things on your agenda and on theirs.
All right, then I will leave it where it is and move to approve the agenda as is.
Okay, motion by Borelli, second by Davis. Can we get a roll call, please?
Commissioner Borelli,
Aye.
Commissioner Byers,
Aye.
Commissioner Darvish,
Aye.
Commissioner Davis,
Aye.
Commissioner Freiberg,
Aye.
Vice Chair Meltzer,
Yes.
Chair Palmieri.
Yes, thank you. Can I get a motion to approve the minutes?
So
So
moved.
moved.
Okay, so moved by Meltzer, second by Borelli. Can I get a roll call?
Commissioner Borelli,
Aye.
Commissioner Byers,
Aye.
Commissioner Darvish.
Aye. Sorry.
All good. Commissioner Davis,
Aye.
Commissioner Freiberg,
Aye.
Vice Chair Meltzer,
Yes.
Chair Palmieri.
Yes, thank you.
Perfect.
This brings us to E for public comment. This is public comment that is not to do with the social services funding recommendations. That will be under item 3A. So are there any public comments that are not to do with 3A?
If there's anyone in attendance, please feel free to use the raise hand feature if you so wish to address the commission not related to item 3A. Chair, I don't see any. We can move on.
Thank you very much. Consent calendar, all items. 3A, unfinished business. I will be turning this over to David. This is the 2022-23 social services funding recommendations. David, you're on mute.
Good evening, Chair Palmieri, Vice Chair Meltzer, and Commission. I'm David Juney. I'm the manager of the City Social Services Division. I'm joined this evening by Leslie Eisenberg, Social Services Supervisor, Derek Murray, Joan Mithers, Katie Egan, Social Services Program Administrators, Dee Saunders, Social Services Specialist, and Joyce Britton, Administrative Assistant. This evening, the Human Services Commission will consider staff recommendations for social services contracts for the October 1st, 2022 through September 30th, 2023 funding period. Along with this staff report, our two recommendations have been included. The first being that the commission will review and recommend the City Council approve staff's recommendations for social services contracts based on the current approved budget allocation of $6,378,852. The second recommendation is that the commission review and recommend the City Council approve an additional $314,774 in general funds to be allocated to social services contracts to enter into and or augment the following recommended contract. The full $314,774 supplemental funds will be added to the general fund allocation in order to enter into a contract with Healthcare in Action. Subsequent to the final staff report being posted on the city's website, the Saban Community Clinic notified staff that they would be withdrawing their application from the funding process, citing burdensome administrative requirements of the contract, the long-term impacts of COVID on clinic staff, future ramifications of the city's living wage ordinance on the agency as a whole, among other factors. Originally, staff had recommended a funding allocation of $207,702 to enter into the contract with Saban. Staff has applied that general fund allocation towards the recommended contract with Healthcare in Action, thus reducing the request for unallocated reserves from $522,476 to $314,774. Social services staff provides fiduciary oversight of the city's allocation of general fund dollars dedicated to the provision of direct social services. Staff base the recommendations that you have before you on the approved general fund budget. The request for additional funding is for a program that was called out by the majority of boards, commissions, council members, and other stakeholders that provided input into this funding process. The current allocation reflects a $1 million increase in social services funding. This is the largest increase the division has seen since cityhood. In addition to meeting city priorities, recommendations are also based on history of service provision. if a program has experienced challenges in meeting agreed upon goals and/or other aspects of the city's contract requirements, staff will not be recommending that the city continue in that contractual relationship. Subsequent to presenting staff's recommendation at last week's Human Services Commission meeting, a public hearing was held to receive input from the community on those recommendations. This evening, staff is available to answer questions regarding the recommendations from the commission. And I turn the mic back over to the chair.
Okay, we need to do a procedural motion, so don't everybody freak out. We just need to open this up, and I'd like to refer to.
I make a motion to approve staff's recommendations for social service contracts.
Okay, that motion is moved by Chair Meltzer. Do I get a second, please? Please understand this is just opening it up for discussion.
Second.
Commissioner Darvish, second. All right, now I want a procedural, I'm going to ask a procedural question. Do we need to take a vote to open this, or can we just go into discussion?
You can go into discussion.
Okay, so just so everyone is aware, that does not mean that we just approved everything or that we agree with everything. We just needed to legally open this up for discussion. That being said, I just want to read 3A. The Human Services Commission will consider staff recommendations for social services contracts for the October 1st, 2022 to September 30th, 2023 funding period. With that being said, is everyone in agreement with staff's recommendations? Can I get a motion for that? No? Yes?
I have a dumb question.
Stephen?
Yeah. I was just curious to note that if we were within, since the bond withdrew and there were monies shifted and changed the actual agenda and the actual way people looked at what they had already seen, I wondered if we have to go ahead and do what we're supposed to do this evening, or we need to wait until it's been looked at by the general public, because there has been a shift in money. That's my only question.
So the city clerk is here for that, I believe. Melissa? Yes, hi.
Hi, good evening, everyone. So the revised proposal and recommendations that was sent to the commission today was also published on the commission page so that the public is aware of what the change in recommendations are. So you should be able to proceed with the funding recommendations that the commission is setting forth this evening.
Okay.
And a question before we
Darvish.
question, just the question that I think was asked last time, and I didn't speak out about not moving forward with trans can work, and what kind of gap does that create? I'm sure that was thought about, and there's a mention of another company that's focused on the Latino trans can work that could also help other sort of residents or trans that are interested in getting into workforce in the city. David, can you explain, would that create a gap? Or
David, as I understand it, and I have asked you this several times, the trans Latina is covering gaps from trans work. Am I correct on that?
So one of the new services that Trans Latina proposed is a workforce development component, working with the HTA, the Hospitality Association. They have proposed that they will place, I'm going to defer to Derek, I think, but I think the proposal is for 5 placements a quarter, Derek, for the year as far as job placements through the HTA. And so we are looking to that to replace the workforce component that we had previously with Trans Can Work. They did have some challenges placing folks into employment. I think as we stand now, the most recent program report showed 2 job placements. So yes, they have increased their service categories to include the workforce job placement category.
And just to clarify, it's 5 placements with the Hospitality Training Academy per contract year.
Thank you.
Does that answer your question, Commissioner Darvish? You're on mute.
That's what I understood from last time. Just wanted clarification on that. And is 5 adequate for our population in the city? Just looking beyond what Trans Can Work had done, what goal they had going into, end of this year and next year, would that be enough for the population? Would that be enough support for them?
Well, that's what they have proposed as far as numbers that they have proposed. Certainly, we would like to support them in placing more folks into jobs. That's a goal that was put out. As I said, the current contractor had significant challenges in meeting goals, and the 5 is an increase over what we're currently receiving.
So they're not limited at 5, Commissioner Darvish. 5 is the minimum that we're looking for, and they can certainly go well beyond that.
That sounds good. Thank you.
Okay, I want to do this correctly because I want to hear what any commissioner needs to say. At this stage, are there any providers that need to be pulled from approving per commissioner? Just raise your hand and I'll be able to call on you, but I also want to read these 3 things. If you are looking to either remove funding or add funding, please come up with number 1, the reasoning, number 2, the justification, and number 3, the alternate recommendation, meaning if you're pulling money from one, where is it going, and the opposite, if you're adding money to one, where is it coming from, and what are the justifications for doing so? Okay, so how can we proceed on this legally, David?
If there's no discussion specific to a contract recommendation, you can move the motion to approve the slate of recommendations as set forward by staff.
I have, Jimmy, I'm sorry, I have one more question before we move there. It's not about funding, but it's more about what I heard in the community about fentanyl detox products that we have, and what I heard was that there's barcodes and there's no instruction included with that, so that someone in that situation is an emergent case. Obviously, their phone may not be able to pick up the barcode. I had that issue with COVID test at home test, which is not an emergent thing, but I tried and I couldn't get it come up. So finally went and bought a different product. But so just my ask is if any of our on this list, any of the contracted companies are providing that, could we ask them for sort of a paper instructions instead of barcode, or both, to make it easier for fentanyl or any other test? Sort of a general question.
So let me just be clear on this. You're speaking of fentanyl testing sticks, or are you speaking of Narcan opiate overdose medication?
Yeah, Narcan was the main concern, but again, I'm just bringing it up on and anything that could be emergent that people don't have time to read the barcode and then read the instruction. Cell phone maybe out of battery or whatever.
David, if I'm not mistaken, are there not paper directions included with each? Derek, maybe you would know this. I don't know which one oversees this. Included with each box of Narcan?
I'm not sure about the box of Narcan. For the fentanyl testing strips, they don't have instructions, but the contracted agencies and the city has instructions. The city made postcards with instructions to go with the fentanyl test strips that we distribute at Pride, but the contracted agencies such as Being Alive and the LGBT Center also have packaging with instructions, and it also contains fentanyl test strips.
Does that answer your question, Commissioner Darvish?
Yes, that does. Thank you.
Thank
I have a
you.
question before we start, if I may.
Yes.
I just wanted to ask staff about the wage ordinance waiver. How is the decision being made? Who were the partners that qualified and who didn't? Because I don't think we ever went over that.
So, and let me know, Commissioner Freiberg, if I'm answering your question or giving the information correctly. So there is the requirement that the applicants will meet the city's new living wage ordinance. They have been provided the opportunity to apply for a waiver. The waiver would be for the first year of the 3-year contract cycle. The city we received 2 requests for the waiver from the applicants who submitted. One being Saban Community Clinic and the other Project Angel Food. So they would be allowed to forego meeting the $19.35 hourly rate, which was set for the living wage. But with that said, they would still have to meet the minimum wage rate. And the minimum wage rate for this first year of the contract cycle going into effect January 1, 2023 is $17.50 an hour. So they would have to meet at least the minimum wage rate. We had those 2 applicants that asked for the waiver. They will both be now, just Angel Food will be granted that waiver. But the expectation is that they will bring staff who are included on the City of West Hollywood's grant on our budget. They will need to meet the living wage rate at the beginning of the 2nd year of this contract cycle. Is that what you're looking for?
Yes. And so did you say that Saban was approved for a waiver too?
They applied for the waiver, and Project Angel Food, and they both would have been granted that. It is just for the first year.
Okay, thank you.
Mhm.
Anything else for discussion, or do we want to move staff's recommendations?
I think
Commissioner
you're gonna want
Byers?
Public comment first too, Chair.
I just had one question. Thank you, Chair.
Okay.
Regarding Saban Clinic again, I seem to remember in the last week or 2 of meetings that Saban was the maybe only service provider that provided dental services. Is that right? Yeah. Okay. And
Well, yeah, hold on. APLA Health and Wellness does provide dental services. It is not called out on our contract. We used to contract specifically for that, but dental services are available to community members through APLA Health and Wellness.
and they're covered in the scope of our contract proposal with them?
No, it's not. But the services are still available. For in general, with all of the contracts, we call out the services that are most in demand from our community, and we want to be able to assure that we've got the number of community members that we've agreed upon, how many folks will be served, but the other services are still available to the community.
Thank you for the clarification.
Okay, so I want to remain as transparent as possible. We do have public comment before we make any motion on this or movement on this. And I'd like to go to D.
Thank you very much, Chair. I see that those in attendance are beginning to raise their hand, and I will call on you in the order that your raise hand feature appears. We do have 2 written public comments that I would just like to share with the commission and the public at this moment. And so, excuse me, I am not ignoring you all. I'm just reading off of my screen. And so I do apologize if someone tries to get my attention. So the first public comment that I will be reading is from Shannon Morton, the Social Justice Task Force. And it reads, "My name is Shannon Morton. I am the founder and executive director of LA-based nonprofit Black Women Lead. I am also on the Social Justice Task Force appointed by Mayor Lauren Meister, Subcommittee Housing and Homelessness. At Black Women Lead, we serve the community directly. Every Tuesday and Thursday, we provide groceries and hot meals to West Hollywood and beyond. We have been awarded multiple proclamations from the City of West Hollywood, and in February, Black Women Lead and the City of West Hollywood co-sponsored the Black Market Pop-Up at Plummer Park. Plummer Park happens to be where we service a lot of our unhoused community members on Thursdays. I recently learned of a grant that would be benefiting the organization Hollywood Food Coalition, and I am writing on their behalf because Black Women Lead could not do the work we do without this organization. Every Tuesday and Thursday, without fail, they give us produce and food for our programs. The Black Women Lead Brown Bag Program offers over 400 fresh bags of produce weekly, and the Black Women Lead Hot Meal Program provides 1,300 hot meals a week to the West Hollywood community and beyond. And this is all made possible by Hollywood Food Coalition. Their partnership is not only vital to the West Hollywood community, but to the small nonprofits like Black Women Lead that they service. When we first started, nobody would sponsor us because we were so small. After seeing the work we did on the ground, the Hollywood Food Coalition took us in with no questions asked. So that is why I am asking on behalf of Black Women Lead and other small but mighty organizations that we do everything possible to make sure they receive grant funds. West Hollywood is better because of the Hollywood Food Coalition. We all are. Best, Shannon Morton." So that is the first. And then the second comes from Dawn Moreno Friedman, and it reads, "Dear commissioners and staff, I want to share with you my experience with Seeds of Hope. When I moved into the West Hollywood CHC building, everyone told me now that I was a West Hollywood resident, I would receive great benefits. One of those great benefits is Seeds of Hope. Once a month, they come to the building bringing a well-being package, free fresh produce, a food sample to inspire us. Some of the past samples have been freshly made hummus, Greek yogurt parfait with berries and seeds, a chopped salad with a dressing made from scratch, sometimes a lovely plant for our homes, teas and spices in muslin pouches, and food wisdom. Another component of this program is the garden. They have a talented staff person who oversees this project. Fruit trees, vegetables, flowers, and herbs all grow in this garden. I've tended to the garden. I go there almost every day for that quiet moment to be with nature, and I make beautiful herbal bouquets. I also have one sitting on my kitchen counter. As I'm cooking, I'm pulling fresh herbs from the bouquet for my food. All of this is on La Brea Avenue. Some of my neighbors are on fixed incomes. I watch how they financially struggle living in one of the most expensive cities in the country. With inflation and the cost of food going up, I wonder how they're getting by. Now more than ever, we need Seeds of Hope. My ask is that Seeds of Hope continues to get funding to do the good work they do. Thank you for selecting the best social services for the residents of West Hollywood. With gratitude, Dawn Moreno Friedman."
Thank you.
Thank you. Those are the two public comments that were submitted in writing. And so now I would like to call on Clifford Roberts. Clifford, if you are in the room, yes, you are. You will have 2 minutes.
Evening, Commissioner, Social Service staff. I want to first say Step Up is very appreciative and thank you for the social services recommendation of our program for the RFP for 3-year contracts, certainly looking at this next year. we're excited to continue doing the comprehensive mental health services and homeless supportive services that we have done the past 6 years. I would like to encourage the commissioners to fully fund our program for that additional outreach worker. I know there are some other outreach workers that are going to be initiated. I'm not sure if they're going to cover those daytime hours in which we are in operation. I also want to utilize my time just for some information that as the years have gone by, fewer agencies have been able to provide money management support. And this is one of the important services that we continue to provide. And money management allows individuals who are housed, and we know that we've seen challenges emerge when folks are housed, particularly recently housed. It provides them direct payment of their bills, so their services are not terminated, such as utilities and their rent. We provide a budget for clients regarding accessing food, and also a savings account. We work with the Social Security Administration and promoting these important services. I'm not sure if all of the public or staff are aware that this is an important service that we continue to provide our folks. And of course, our clients have to agree to be processed into this program. Again, thank you so much for your consideration of our program. Again, my name is Clifford Roberts, Clinical Supervisor, Program Manager for the WehoMIT, OCS, and FSP programs. Step up on C. Good evening, everybody.
Thank you. Okay, the next public speaker that I have is Asher. Asher Lendo, if you are in the room, please feel free to take yourself off of mute, turn your camera on if you would like.
Yes, I'm here, Dee.
There you go. Perfect. The timer will begin.
Okay. Thank you, commissioners, for another opportunity to speak on behalf of Hollywood Food Coalition's proposal. I wanted to use my time tonight to clarify one particular point that was raised at the last meeting. The staff recommendation in the report indicates that the city would still like to collaborate with Hollywood Food Coalition in the coming year, but does not recommend a contract at this time. A question was asked by Commissioner Freiberg how we would collaborate with the city without any funding. It was indicated that since Hollywood Food Coalition has partnered with 125 other nonprofits in the past, we could offer our services in West Hollywood without a contract. Unfortunately, all of those previous partnerships were covered by other grant funding, and we would be unable to provide new services in West Hollywood without new funding. We are at a stage in our growth where sustainable expansion to serve more nonprofits in their communities would require additional resources. We are very excited that there exists an opportunity to expand our services in the city of West Hollywood, especially since food nutrition seems to be a significant need among those who work, live, or spend a significant amount of time in the city. We understand there is a limited amount of funding for so many needs and would welcome the chance to contract with the city at a reduced amount so that we can start offering our services and hopefully expand from there. Again, thank you so much for your consideration of our proposal. And we're here to answer any questions you may have.
Thank you.
My apologies. All these windows on the screen. Okay. With that, we are ready to take public comment from persons in the meeting now. Maria, Roman, you have, okay, perfect. There you are. You will have 2 minutes and the timer will begin once you begin.
Am I on?
Yes.
Okay. So first I want to say thank you to the City of West Hollywood for the last 3 years of ongoing funding for programs within our organization that have really made a difference in the lives of so many trans people. I also would love to thank Derek, who has been so supportive through the 3 years that we have been providing services. One of the main concerns that I have as we're moving through this process that I've seen that although our organization has had some increase in funding, if you look at the entire catalog of funding for trans services, there's actually a decrease in funding for trans-specific programming. I know that there's a lot of LGBT folks programs that are getting funding, but the challenges continue to be that trans people are really having a hard time accessing so-called LGBT spaces that are providing services to the whole entire spectrum of the community. We as an organization have experienced challenges in linking our clients through this grant to even some of the partners within the last funding cycle, although they are also providing services to trans people. So my ask to the city and the commissioners today is to recommend that we're fully funded for the full amount of the proposal to make sure that as an organization, we can have the most impact in addressing the challenges and ongoing obstacles that trans people who live, reside, and spend a large amount of time within the city of West Hollywood, that we can address those challenges. Obviously, the city of West Hollywood, for many trans people that come across from the entire United States, fleeing hateful situations, they find refuge within the city. So I would hope that you would consider fully funding us. Thank you.
Thank you.
Thank you. Okay, so I don't see a name. Staff meeting. Okay. You already knew that it was you.
Yes, hi, my name is Lisa Marie Ceballos. I'm one of the case managers here at Now Coalition. I have a couple of folks that would like to speak, including some staff. So I don't know, we would need some translation for a couple of folks. We can start with Mónica. You wanna start? Puedes hablar en español, Lisa.
Mi nombre es Mónica Ocaranza, tengo 40 años. Gracias a Lisa que me encontró en West Hollywood, me contactó con el programa Program en Translatina Coalition, que estoy bien agradecida con estos dos programas que me han ayudado bastante en mi vida, ya que he sido homeless.
Somebody wants to translate?
Thank you so much, Lisa. Is our interpreter?
Yeah, interpreter's here. Can you hear me? Or...
Before we go any further, can I ask two questions? One, that you give the interpreter a breather so that he can correctly say the sentence and not say everything you have to say. And I'd like to ask the city clerk if indeed everyone gets 2 minutes or if the organization as a whole gets 2 minutes.
So it's at the discretion of the chair if you would like to give each of them 2 minutes. Typically, we have to give additional time when translation is required. So it's usually 3 minutes. Okay. It would be helpful if Translatina could pick a couple of individuals to speak on behalf of the organization, but again, it's at the chair's discretion.
So before we go any further, can you please give the interpreter a chance to interpret? And although certainly all of you can speak, if you have a few folks that want to get the message across, that's welcome also. So let's go with the first person. And where is the interpreter?
They're here.
Okay, I see.
Oh,
I see them.
thank you so much. They just turned their camera on, so you should be able to see them now, Chair.
Thank you. Okay, so you folks can begin.
Comienza otra vez de nuevo, pero tienes que dar pausas para que el interpretador pueda interpretar lo que dices.
Hola, mi nombre es Mónica Ocaranza, tengo 40 años.
Yeah, hi, I am Monica Alcaranza. I'm 40 years old.
Yo habitaba en West Hollywood. He sido homeless gracias a Lisa y al programa de Program en Translatina Coalition.
I live in West Hollywood and I was homeless, but thanks to the intervention of this program, Trans-Latin program,
me han ayudado bastante estos dos programas. Estoy muy agradecida con estos dos programas. Me da gusto que existan estos programas porque ayudan a mucha gente a superarnos, a salir adelante, a ya no estar en las calles, a salir adelante más que nada.
And I just want to say that this program helped me, but also has helped many other people who have been facing difficulties of homelessness and so on, living in the street. It has made all the difference. Thank you.
Okay, we can go to the next one now.
My name, hola, me llamo Odalis Rodríguez. Tengo 51 años. Vivo en West Hollywood. Tengo 20 años viviendo en la ciudad de West Hollywood.
Okay.
Yeah, my name is Olga. And what was the family name? Sorry, Olga. Go ahead.
Odalis Rodriguez.
Rodriguez. Olga Odalis Rodriguez, 51 years old, has been in West Hollywood for 25 years already.
Ok, gracias a Translatina y el programa de True, me he beneficiado en muchos aspectos de mi vida, porque yo estuve muy mal de salud y ellos me han apoyado poco a poquito y yo se los agradezco.
And I want to say thanks to these programs, both this Trans-Latin and I believe another program called Truth Program, that, I was in very poor health, and step by step, these programs have helped me to become much more healthy.
Y yo quisiera tener más oportunidades también para poder tener un trabajo fijo.
And I would like to have more opportunities to have a real regular employment.
Y necesitamos mucho apoyo para poder salir adelante todas las transexuales.
And these programs give a lot of support to all of us transsexual people.
Porque no en todos lados nos dan oportunidades de tener trabajo.
Because not all programs are actually able to give us a solid job prospect.
Okay, we're going to go to the next one. With Nina and Rio. Como tú quieras inglés.
Okay, I'm trying to say this in English because it's faster. My name is Lina del Rio. Thank you for letting me speak again. I live in the city of West Hollywood. I'm 66 years old. I live in the city of Hollywood for 42 years. Of those 42 years, I've been HIV 42 years. I need sometimes extra help because the income I have is not enough to cover all my needs. I went to the Plummer Park in West Hollywood, which I adore the city, but they deny help to me several times. And I was there once. I asked for the electricity bill. They give everybody in the room checks. When it was my turn, they didn't give me. They said there was no funds. Okay, I don't want to make fingers on anyone, but I just trying to say this because after that, I came to Trans-Latina Coalition, and this is the only place that I really, with the program through, that helped me, and I feel like I matter. I feel like a human being. I don't feel left alone. Even I live in that city for 42 years, and I used to work, and I pay my taxes, and I can't do that anymore. So whatever help you can give, then is very well deserved. So that's all I have to say. I'm sorry for taking my time.
Thank you.
Gracias, mi nombre es Elsa Johnson. Tengo 62 años, he vivido en West Hollywood por 35 años y siempre busco.
Translator?
Yeah, but my name is Elsa Johnson and I'm 65 and I've been here for, sorry, Elsa, ¿cuántos años estuviste aquí? ¿35? ¿Cuántos?
35.
Yeah, 35. I've been here for 35 years already.
Y bueno, yo agradezco ante todo a todo el staff de West Hollywood por preocuparse por las transgender seniors, que es muy importante porque nosotros ya dimos nuestra vida por este país.
And I want to make a particular sort of thank you for the help that the Trans-Latin Coalition provides for senior transgender people. This is very, very important to us.
El programa True es increíblemente bueno, pero sí me encantaría que nos apoyaran un poco más porque desgraciadamente económicamente no estamos bien. Trans-Latina hace todo lo que puede, es un lugar precioso, maravilloso. Y yo como una persona seria.
Yeah, and I want to say that the Truth program is really excellent, but absolutely needs more economic support.
Yo como una persona seria sí pido, doy gracias a Trans-Latina Coalition porque ella hace todo lo posible por ayudarnos y es la única, insisto, la única agencia que ayuda a las transexuales. Otras agencias tratan, pero no ayudan. Aquí realmente ayudan. Yo agradezco mucho. Por favor, miembros de West Hollywood, tengan compasión de una persona que ya dio su vida y que he vivido en West Hollywood, he pagado renta y todo, he pagado taxes, que he dado mi vida, ahora necesito apoyo porque yo soy una senior, señores. Gracias.
And I, as a serious person, I want to underscore my thanks for the Trans-Latin Coalition, which does everything possible to help us. Some other organizations talk, but it's the Trans-Latin organization that really does effective work. And I'm asking you for compassion. I've given my life to this community. I have paid rent, and now I need help as a senior.
Gracias y les agradezco.
Thank you so much.
We're going to continue our staff.
Hola, muy buenas tardes. Mi nombre es Fanny Méndez. Yo trabajo para Trans-Latina Coalition. Soy compañera de Lisa Ceballo, el cual nosotras vamos a hacer outreach para la comunidad en la comunidad de West Hollywood.
Entonces, ¿usted es compañero de quién?
She's my partner when we do outreach in the city of West Hollywood.
No, I got you. ¿Cómo se llama su compañero?
Suani Méndez.
Sueli Mendez. Yeah, I'm Tony Mendez, and I'm the partner of Sueli Mendez, and I actually work for the organization.
Creo que lo más importante en este tipo de trabajo, en este tipo de outreach, es ponerle la mano en el corazón, ya que en la ciudad se miran bastantes personas homeless de la comunidad trans.
Yeah, and I think that the main thing here is to have a heart, because we have homeless people living here in the community.
Como Trans-Latina Coalition, nosotros nos encargamos de ayudar a las personas con las necesidades específicas.
And the role of the Trans-Latin Coalition is to help people with their particular needs.
Pero si la ciudad de West Hollywood nos apoyara con más recursos, nos apoyara con ayuda monetaria para poder ayudar a estas personas, creo que estuviéramos ayudando más a la comunidad que vemos día con día, homeless and
Okay, but I believe that if West Hollywood, the city of West Hollywood, would give more support essentially in the form of money, that we would be able to do a lot more for the homeless community.
That's it. We have our last person, Rita Garcia, and she don't need a translation.
Hi, everyone. I am Rita Garcia. I'm a staff here at the Trans-Latina Coalition. I am Lisa Ceballo's colleague. I do peer support navigation for PrEP program, which is prevention for HIV. And I work hand to hand with Lisa. We had done many of outreaches, especially in West Hollywood. And through these outreaches in West Hollywood, there's so many challenges in just trying to navigate a client. We have experienced successful stories, but there's gaps missing throughout the success story. There's so many challenges, whether they need a work, they need job, they need food, they need a way to communicate, they need transportation, they need other gaps that are missing on the entire connection when it comes to an outreach. The successful stories and the challenges that my coworker has faced has been magnificent, because there has been a life transformation in the community of the trans community, which has been faced daily and been rejected of having a regular job. We're having this challenging to just have a regular job. We don't have a recommendation or a system to be able to sustain someone, whether we find them a house or nothing. So these challenges are missing. So these funds are very important to meet the goal, to meet the target, to be able to manifest and go overboard and get more people communities, because these communities are also facing the gender, not accepting gender, and other facilities that they get in West Hollywood, they're not being helped. That's why they go and feel comfortable in Trans-Latina Coalition, because they relate to us because we're trans-based organization. And that's our commitment, to make not only the impact, but also sustain the client to be able.
Thank you so much, everybody.
Thank you very much.
Yeah, thank you so much for your time. We really appreciate it. And hopefully you guys consider, to get the full amount that we have proposed. I think it's important to continue this critical work for our trans and non-binary community. And like Rita and many other colleagues were saying, it's important for these clients when they come in to see representation of themselves and to see somebody that has been in the same shoes that they have been. So thank you once again for your time. And we really consider that all of you guys think about us. Thank you.
Thank you. Dee?
Okay, Michael McFadden, you are up.
Hello, my name is Michael McFadden. I'm the Associate Director of Programs at the LA LGBT Center in the Senior Services Department. First and foremost, we just want to say thank you to the City of West Hollywood for all of your previous support, both emotional and programmatic, as well as fiscal, as well as wanted to thank the staff for recommending our current proposal, the funding for the current proposal. And with the expansion of the funding, we're able to continue not only the great work that we've been doing, but also expand and support some of the ways we've been addressing food insecurity within our community as well. And while we appreciate the city's 2% across the board increase, we just wanted to name the fact that this is not sufficient to match the increases that we as an agency are facing, specifically around staff compensation. The personnel cost is one of our largest expenses, and the 2% increase does not cover the increases that we are facing in that budget line item. Specifically, this is a time where nonprofits are really struggling both to retain talented staff as well as to recruit folks into the field. We were, which people are very well aware of the great resignation that occurred during COVID. We were a microcosm of that macro scale departure, and are continuing to feel the ramifications of that. And compensation is one of the ways that we are able to attract new folks to the field. And right now there's an expectation that compensation will be higher than it has been historically, as well as given the recession and increase of expenses, both in terms of rental costs, which is probably one of the largest, but also food costs. Staff are requiring a higher compensation. So again, thank you so much for your support and appreciate your consideration.
Thank you, Michael.
Thanks.
Thank you. Michael Hochman, whenever you're ready.
Yeah, hi everyone. My name is Michael Hochman. I am the Chief Executive Officer of Healthcare in Action. I'm a primary care doctor. We're a new applicant. I introduced myself a couple of weeks ago, but I just thought I would introduce myself again because I know there were some questions about our program last week. Just as a reminder to the commissioners, we are a nonprofit. We got launched about a year ago with the support of a grant from SCAN Health Plan, which is a nonprofit Medicare plan. We are now a team of nearly 25 clinicians throughout Los Angeles County. We have 2 full-time primary care doctors. I'm one of them. We have 2 part-time psychiatrists, 5 physician assistants, 3 nurses, and 10 peer navigators working throughout the county. We provide full scope primary care services, as well as addiction medicine, psychiatry, and also wraparound case management. We do this all using a street medicine model, so we do not have any brick and mortar clinic, but rather we have mobile medical vans, and we go out and see patients who are unhoused where they are in encampments and shelters or wherever that may be. There was an excellent question from one of the commissioners about the fentanyl, and maybe I'll just say a quick word on that. We'd be very happy to do an in-service to you or anyone else in the community because it is so important that people know how to use these correctly. There's a naloxone nasal spray, which is used to reverse overdoses. It's very easy to use, but people do need to understand how to use it. Similarly, the fentanyl test strips, which are used to tell if a substance is laced with fentanyl, very easy to use, but someone does need to show you how to use it. And we always do that when we give it to a patient. We may ask how we ended up in West Hollywood. We wanted to do something in the northern part of LA County. We had a great opportunity to work with Cedars-Sinai. We really enjoyed working there. I would estimate that we have about 30 patients who are unhoused, who we are now the primary care provider from, and we're excited about the possibility of expanding our services. I'm here to answer any questions that you all may have today. Thank you.
Thank you, Doctor.
Thank you. And Andy Soccer, you are up.
Good evening, Chair, Vice Chair, Commissioners, and staff. I'm Andy Soccer, Program Manager for the Career Center. JBS is responsible for 94% of West Hollywood's vocational goals this year, yet our funding allocation is only around 2.5 of the yearly human services budget. Last week, I requested you to consider our full request for funds, primarily to pay for a second half-time career coach. That would bring us up to 2 full-time employees only. That's still a skeletal staff. As we ramp up in a post-COVID economy, we need these 2 FTEs to provide the service that you expect, including the goal to increase our BIPOC clients, which are primarily in the workforce. In addition, staff recommendation is a 2% cost of living increase. This year, when we are facing 2-digit inflation, the state is currently requiring a 3.3% increase in minimum salaries that are exempt. So I highly recommend that the commission, at the very minimum, consider a 3.3% cost of living increase for all. Thank you.
Thank you. Is there anyone else? I've scrolled the pages. I don't see another hand, but perhaps you do.
I do not, Chair. And if there's anyone left that would like to respectfully speak now or forever hold your peace. Chair, we are all done. Public comment.
David, I want to ask you a question. At this stage, we're going to discuss, but we can also make a motion to approve those providers that we are not pulling or that no one is pulling or questioning, correct?
Correct.
Okay. All right. So I'd like to open this with, is there any discussion coming up from any of the commissioners? Please let me call on you. I have 100 boxes in front of me and I just want to be able to see where you are. Commissioner Davis?
I have a real quick question for staff. The dental question about APLA, is dental and APLA is open to all residents in the city of West Hollywood or only HIV positive men?
I believe it's HIV positive. Derek? Yeah,
Correct. APLA Health and Wellness is an FQHC, so dental services are open, but their specific funding, they're specifically funded to work with people living with HIV. So there are some services that people living with HIV can access at APLA that others can't.
Including dental, Derek?
Correct. Yes, I'm talking about dental specifically.
Because I think your answer kind of suggested that Saban's dental was replaceable by APLA still being in the city, and it really is only for a subset of the people who live in the city of West Hollywood. That's my understanding.
That's correct.
Okay, I just wanted to make sure I was on the right page. Thank you.
David, I want to revisit this for a second. Although they are not asking for funding, dental services at Saban are open for all West Hollywood residents regardless, correct?
That's correct.
Okay. All right, any other commissioners with question or discussion? Or Ellie?
What do you mean by question or discussion?
What about anything?
I mean,
any
I have some things I'd like to say, and then I have a proposal.
Okay.
I don't have any particular questions of the staff at this point.
What is it that you would like to propose or say?
I just didn't know if we were at that point yet, or if we were still doing clarifying questions.
I think you're okay to go.
Okay, so first, and I apologize, I forgot to mention this when City Clerk was on. I have to recuse myself from any vote on Seeds of Hope. While Seeds of Hope is their own nonprofit organization, they do come to a good number, I believe 8 and probably more WHCHE affordable housing buildings. I'm an employee of WHCHE. The money does not come to us. But as I've done previously, it makes sense for me to recuse myself for a vote on Seeds of Hope. And I just want to check with the city clerk.
I don't think it reaches the level of a recusal. It's probably better to abstain from the vote and simply say that due to your employment with West Hollywood Housing Corp., it doesn't reach a recusal level, but you will abstain from the vote on that particular funding allocation for that contractor. Thank you.
Great, thank you. So the few things I want to say is, last week and even today, I am 92% there with staff. Eventually I'll make a proposal. I will say it's very sad about Saban Clinic. I will say I'm not surprised about Saban Clinic. I knew that this wage ordinance was going to be a thing. I can't blame it all on the wage ordinance, but it's certainly an item we've heard before. We talked about it before. Staffing issues are going to come up. And on the one hand, you have to be able to pay. On the other hand, you have to create your budget. So it is a challenging situation. I did say last week, I think a 2% COLA, I wish our city council members bluntly had really taken this into consideration and did at least 3% across the board, especially for the staffing component. I support an increase from the general funds, but in a different way. There are some things like I agree with in terms of keeping folks at the same level, but I find frustrating. Understandable Men's Health Foundation, Housing Works, JFS, Friends Case Management. I do really think that staff thought those things through. I also think that there are times, and we've heard this from community members, that navigating through multiple agencies is challenging. And I think there were some cases where we might have been able to hit some things, more things under one roof, but I get it. I also think we still need to be aware of community members who don't live here and the outreach to them. And anybody that's still on the phone in terms of the social service providers, I really hope you hear this is important to us to reach community members who don't live here. I'm concerned related to Commissioner Davis's question about dental. I'm concerned about some items with the LA LGBT Center, WeHo Life in particular, and their legal services. If their main mission is to reach LGBT and serve LGBT, I hope that with a date rate funding and with other funding that they're also going to do outreach to Sunset Strip, hotels, nightclubs, etc. I think that's really important. I mentioned I'll abstain from Seeds of Hope, even though I'm not directly, or my organization isn't a financial beneficiary. I do think the numbers aren't quite there, but that's a different story. It's really sad about transcan work and understandable. This brings me to my biggest concern is about the recommendation for healthcare and action. I really dug into this 2 weeks ago. I think it's really the way to go in terms of serving our unhoused community members, having a team of this level out in the street. We have seen the Met team work, which is like a smaller version of this. I've personally experienced the Met team working from an unhoused community member who lived at the bus stop on the corner of my street for 9 to 10 months, and working with Corey Plank, Elizabeth Anderson, our former colleague. I was lucky enough to have witnessed the Met team actually get this gentleman into a van on his way to get medical help. and hopefully all of the wraparound services. So I'm really excited about the opportunities with Healthcare in Action. That said, and this was mentioned earlier, there's this organization is less than a year old, and their teams are just a little over 6 months old. So it gives me great pause to put $500,000 to an organization that is fairly new. I like that SCAN is behind them. I think that makes a lot of difference. I like that Cedars is behind them. Cedars is such a huge, great, well-known, established partner in this organization. Been great with the city, been great with my organization. So it helps me feel better about that. But we're putting our names to this, and this is a rather large investment. I do have concerns about their ability to staff up. These are not inexpensive roles, physician's assistants and so forth. So hopefully there's not challenges there. With that said, I would go along with the staff recommendation to fund at this level. However, given that Saban withdrew today, I do think that we should make some edits. And in some ways, it feels like we were asking the city for this much money, and now we're going to ask for a little less. And I don't like to ask for less. I like to ask for more. So with that said, I do think Healthcare in Action, I would keep them at the level or closer to the level that staff was recommending. However, I would like to add the JVS WeHo Works. I do think that we should go up to the full level that they're asking for. One, they are a legacy organization. They've had challenges in the past, but they've certainly been doing well lately. Also, they can fill a gap that trans can work will not be able to access without a contract. And while they're not a trans-specific organization, they certainly can serve the trans community. I also believe that they'll be doing more outreach to our more community members. And Trans Latina Coalition. I do think that that is another, these two of these together kind of come out to almost $100,000. Please don't ask me to do the math on the spot. Mr. Davis can help me with that if necessary. But my recommendation would be to disperse roughly half of the Saban's money to fully fund Trans Latina Coalition, to fully or fund what they asked for, and to fund JVS WeHo Works what they asked for, and then rework the numbers for Healthcare in Action. That's it.
Okay, let me just digest this for a second, Sam, because I think I have a question for you. Rework the numbers. And I know you deferred to Stephen for math, so can someone give me some numbers so I can write them down?
Sure. I don't have the exact numbers, so if somebody else does, they because I kind of went like 250 to.
Yes, I can do it. And so the way that I understand it, Commissioner Borelli, is, and I'm going to ask either David or Derek, because I don't have the proposals in front of me. I just have our recommendations. So if someone can give me the totals.
T, the full amount for Trans Latino Coalition, the full ask was $250,000.
Okay. And what is the full ask for JVS? Do we know? Does someone have it handy?
So Commissioner Borelli, you wanted to give JVS the 3% COLA. Is that what I understood?
I know that Mr. Sacker was just on us with that, but I think we should just go with what they have in the proposal to keep it clean, the 195,996.
That's right.
I'm basically for both organizations asking to give what they asked for.
So to fully fund Trans Latina and JVS, do you have that, D?
Yes, I do. And so I'm going to do the calculations. So staff's recommendation for JVS is, oh gosh, let me just make
158,692.
Thank you, David. I'm so sorry, trying to move all these screens through. 158,692 for JVS, and our for Trans-Latina Coalition, 198,565, right?
Correct.
565. So the two of those currently, staff recommendation is 300. Let me just move this down. So sorry, please bear
That's
with
okay,
me.
please.
350. Oh my gosh. And I wrote it on the wrong screen. Okay, let me run that back. David, I'm so sorry. Can you please give me
Okay.
those totals again?
Sure. So staff's recommendation for JVS was 158, 692.
And then Trans-Latina Coalition,
Staff's recommendation is 198, 565.
565. Okay, and the two staff recommendations for those total 357,257, and Commissioner Borelli would like for it to be the full total, which would be 445,996. And so the difference between those two, the full funding of what was asked, which is the 445,996, minus the staff recommendations of funding, which is 357,257. So that's a difference of 88,739, which would mean that we would decrease the staff recommendation of, let me go up to healthcare and action. So it would decrease the staff recommendation.
Sorry, actually not decrease the staff recommendation.
Just ask for more from
I'm
council.
so sorry, Commissioner Borelli. So when I say that, I'm saying to take the money out of the general funds, so that we can allocate our general funding money to fully fund both JVS and fully fund Trans-Latina, and then return that $88,739 difference onto the supplemental, which would increase our ask from for the council. Is
Bam.
okay. So okay, so we will how I'm about to do it now is taking this $88,739, which, let me write this down on the side, 88,739, taking that from the general funded amount for healthcare and action of the 241,419, which would bring healthcare and action's money from our general fund down to $152,680. And then, because I see your face, Commissioner Borelli, and then, sorry, I'm writing this down as well because I like to keep notes. And then it would take our supplemental funding ask up from the 314,774 to 314,774 plus the 88,739. It would take that up to $403,513. And it will still have them funded at the ask of $635,956.
That sounds about right, based on my rough math that I was doing as things were progressing today. Thank you very much.
You're welcome.
David, your math?
So I'm in agreement with the math. I'm in agreement with the math.
That was very polite.
Good job.
Okay, so I have the numbers in front of me. How do we move on this, David? Does Commissioner Borelli have to make a motion on this?
Well, I would, because Commissioner Borelli has pulled out 3 contracts to make alternate funding recommendations. I would pull those 3.
Okay.
And then unless there's others that folks would like to identify and discuss, I would ask for a recommendation to approve the remaining slate.
Okay, let me try to go over this, please. So Commissioner Borelli is making a change to, And to Healthcare in Action, number 1. To, I hope I'm getting this right because I was writing as quickly as I could. Translatina and JVS, correct, Sam?
Correct.
Okay, so those 3 will be pulled. And is there any more discussion, or can we approve the rest of the staff recommendations? Who's speaking? Just raise your hand and let me see who it is. Commissioner Davis?
Just because the door has been opened by Commissioner Borelli, this was an idea that I had the last meeting. That was my question about the $33,000 that was allocated for healthcare and action out of the fund that we, $6 point some odd million. And I didn't understand why the entire amount wasn't asked for through the supplemental funding. So Mr. Borelli has kind of opened the door, and I had also would like to have seen 2 different items come out of this money, but only out of the 33,000 originally. Now it's rather large because of Saban, which I'm disappointed to find out about. But I would like to see the Seeds of Hope receive its full funding as well. And I'm not certain what those numbers are, but I can tell you that I think that the amount of work that they do and the amount of good good vibes or something that I'm getting from all of the different commentators, et cetera, that this is a program that actually used its entire. I'm willing and very interested in some type of partnership with the Hollywood Food Coalition. To be perfectly honest, when I read all of the reports, the request for funding, this one was the most exciting one to me because it did something that I really have a great belief in, and that's keeping food usable and recycled for a lot of people that could use it. So I don't have an amount in mind, but I would really like to stress that the city look for a way or an avenue to come up with some type of funding for the program. I'm not certain from listening to Mr. Roberts today and from others that this will just happen because we want it to. I think that we have to put our money where. But so my only actual concrete proposal is for Seeds of Hope, a full funding. Also out of the $100 and some odd thousand that's left from the healthcare in action. So that I would like to add that to Commissioner Borelli's list of items.
So you're asking for full funding from Seeds of Hope. I don't have that number in front of me. David, do you?
Yeah,
Dee, do you?
It's 134,563.
34,563. 563?
Yes.
Correct.
And
all right, so we have pulled JVS, Translatina, Seeds of Hope, and Healthcare in Action.
just also a quick personal note, I actually use a couple of these different agencies that we're going to fund. I don't believe that's a conflict of interest from the point of view that I've heard it. If people would like me to delineate the ones that I use, I will, but I don't see any reason for me to accuse myself or to abstain unless so asked.
Is the city clerk in the room?
I am.
So can I ask you a question? From what I understand, you do not have to recuse yourself if you feel you can make a non-biased vote or judgment. Is that correct?
Correct, and it would be an abstention. So an example that I give to people is Mary Smith is your next door neighbor. Mary Smith uses, I'll just use JFS. And you know that Mary loves JFS and has been really happy. And so based on Mary's experience, you love JFS, not based on the testimony they provided during the public hearings or the documents they submitted, but simply because you love Mary and Mary loves JFS. So an abstention is when you can't separate your personal feelings from your role as an appointed official. And so if you feel that you can't do that, then you should abstain from the vote and indicate what that conflict is. Now, recusals are completely different and that reaches a higher level, but that's when an abstention would come into play.
So let me ask you something about an abstention. If indeed you feel that you can make a decision without bias, whether or not you use that provider or that service, you can still vote or you must legally abstain?
No, you can still vote.
Okay, all right. I just needed that clarification. Stephen, does that answer?
Yeah, I don't believe that I would be prejudiced one way or another.
Yeah.
So I would be able to do so with a clear conscience.
Yeah.
I just do not want to pollute the actual proceedings. So I just, if there's anyone who objects to that, I will gladly tell you who I use and abstain. But otherwise, I feel that I can vote without any difficulty.
Great. All right, so now we're pulling JVS, Seeds of Hope, we're pulling Translatina, we're pulling Healthcare in Action. And Stephen, I'm sorry, but I think there was something else.
I just wanted to suggest, I don't have a figure. I'm not in the position to say that I think X number of dollars should go to West Hollywood Food Coalition, but I am disappointed that the fact that it didn't receive any monies at all. And I would like.
Speaking of what?
So I'm just being, what is that called? I'm just making commentary that I would like to see a partnership somehow developed between the city and that particular organization.
Hollywood Food Coalition.
So yes, but I don't see any way I can just pull a number out of my hat that would make the thing work. So I'm just trying to get the point across that I think that this is a very worthwhile organization, and I'm not certain that we are giving them the proper look at or go over. So that's just a personal opinion. It's not something that I want to see actual numbers to.
Okay, so David, just for clarification, so that we're being very clear about this and open, you fully intend to nurture a relationship with Hollywood Food Coalition, regardless of not funding them. Is this correct?
That's correct.
So over the next several years and over the funding cycle, you will have at some point or all the way through developed a relationship with them, so that if indeed they do come up at the next cycle, you'll have some more concrete information and be able to advise more on this. Am I right in understanding that?
You are correct, and we've had similar recommendations prior. I think you all recall last time around with Project Chicken Soup, that has come in for funding for a couple times. We worked closely with them when they lost their kitchen, which is right during the funding period, but to try to connect them with Project Angel Food at that time to share their kitchen. But anyway, we kept contact, we kept supporting them. And certainly this is a program I think we're all very interested in. It was interesting to me to hear the public comment that without these funds, they wouldn't be able to assist West Hollywood, because it seems interesting that we would be singled out. And I don't understand that. But,
and I think, David, that's what I heard. Excuse me for butting in, but that's what I heard. And that does concern me a little bit, because I would like to see the benefit that I'm thinking is received from this particular organization. I don't want to miss this benefit if it's possible. And I know that we can have a relationship, but I also know the relationships actually have a little money behind them mean more in the long run, and we're able to do more. So like I say, I can't pull a number, and I'm not going to pull a number out of my hat for this particular organization, but like to see something in the future.
Okay, so Stephen, since you're not pulling a number and you're not making a recommendation and you're not coming up with any three of the items that things I said, let me just ask you a question, please. You're just giving your opinion that you would like to see this in the future. You're not making a recommendation to pull this, correct?
No, I don't believe I can do that.
Okay.
I don't know what, like, is $10 enough and is $20 too much?
I totally get it.
All right.
I absolutely get it. I understand. David, you've taken all of that into consideration, correct?
Correct.
All right. Commissioner Byers, do you have your hand up?
I do.
Please.
I just wanted to first get clarification if Commissioner, I'm sorry, my phone's ringing. If Commissioner Davis is asking to fully fund Seeds of Hope, where would the difference of, I think it's $58,675 come from then?
Can Dee answer that since she did the math, please?
I was interested in it coming out of the funding that we're actually guaranteed, which is the $6 some odd million, and that the line item would be from the Healthcare in Action, where the Saban money went. And so that's where I would like to see that money come from, and then add, as Commissioner Borelli did, to the money that we're going to ask for from council. I tend to believe in the same, what's that called, mantra that Commissioner Borelli has. If you're going to ask them for $1, you might as well ask them for 10. So I think that's a better idea.
Is that exactly what you have, Dee?
Yes.
All right. Stephen, I'm not doubting.
That's where the adjustment would come from.
Yeah, Stephen, I'm not doubting your math. I just want to make sure we're all on the same page, okay?
I had another question, if you don't mind, Chair.
Yeah.
And Commissioner Davis, I appreciate the recommendation to increase and your support or your thoughts towards the Hollywood Food Coalition. I also thought it was a really innovative proposal, really creative. It made use of what West Hollywood has to offer in terms of sort of an abundance and what I often see as an overflow or excess of food. And I was really happy to hear that there's already, it seems like, community partnerships at work where Hollywood Food Coalition has been putting that food into action. And it seems that Seeds of Hope is already getting an increase in funds from what their current funding level is. It's not the full amount that they've requested, but the staff recommendation is an increase in the funding that they've experienced in the last cycle. So if there is room to increase the amount of money we give total towards food services, I would be curious and interested to hear if others would be willing to take a chance on Hollywood Food Coalition as a pilot. And I do think a partnership that has money behind it is a partnership that will work a little bit better in the city. And this seems just like such an innovative, different model that if we're going to increase total funding allocation towards food services, I'd like to see it done in another organization that could then fill the gap in a different way for that service. It was included in our RFP as a high priority this cycle, food services. And I think they're sort of hitting the mark in a really great way.
I would tend to agree with you. So if the commission would be interested, and if there was a feeling that the staff would, what is it called, kind of be interested as well, I would agree with you. But I would like to see the amount that food insecurity and issues around food, like to see that increase. But again, I do not have an off the top of my head, and so and I'm not certain that I could do that. But I certainly hear what you're saying.
Okay, so if you have no amount, I don't know how to progress with this. It doesn't. I understand what you're saying, and Commissioner Byers, I also understand and appreciate your input on this. But if we don't have an amount, we don't have a reasoning or a justification and an alternate recommendation, I find it a little bit difficult to put this into words. So, Stephen, you're the one senior to me, so maybe you have an idea.
Again, it would be very difficult to pull a number.
Okay.
I would say maybe perhaps, I'm not certain what the original request was. I could look it up here. But maybe a third of that.
Hey, do you have the original request, or David, do you have the original request?
Yes. So for Hollywood Food Coalition, their request is for, excuse me 1 second.
118,217.
Thank you. 118,217.
And for what it's worth, the difference between Seeds of Hope or Seeds for Hope, the increase to their total was 58,675. That's about half of the recommendation for total funds from Hollywood Food Coalition.
So again, I would be willing to fund them, but again, it would have to be a number that makes sense. So I like a third of their request or half of their request. And I'm not necessarily withdraw my interest in Seeds of Hope as well. So, I mean, if we're, like I said, if we're going to ask council for an augmented amount of funding, we might as well ask them for an augmented amount of funding instead of just sort of going at it.
So, Stephen, are you asking, are you raising the ask to council by $118,217?
I'm sorry.
Is that what you suggested? Because I
may be more interested in splitting the difference with as Commissioner Byers has put forth, because I really find the fact that a relationship with the the Hollywood Food Coalition would be beneficial to the city, and I would also think the relationship has a couple of bucks behind it would be more interesting to them. So quite possibly.
Commissioner Byers, was the amount that you brought up $58,000 or $56,000, some change?
It was 58,675, and that number came from the difference from Seeds for Hope's total requested and what was given.
Do you have that written down into the side so we can pull from that?
Yes, I do, Chair.
I'm certainly amenable to Commissioner Byers' suggestion, because this was the like I said, the most interesting of the proposals. I'm not saying that the rest of the proposals were not interesting, nor were the proposals not useful. I'm just saying that this one really piqued my interest.
Okay, I want to ask staff something. If indeed the commission decides to go positively with Hollywood Food Coalition to the tune of $58,675, legally, how does that work with the RFP that we were giving for a fuller funding and for one that you have not made an offer for a lesser funding? How do we work their scope of service? How do we work their goals? What would that entail?
So I can tell you that staff would maintain its recommendations and present a set of alternative recommendations to the commission. Okay. We're not in a position to ask for increased supplemental funding. There have been discussions, been very transparent with the city about what the recommendations are and the increased funding specific to the Healthcare in Action contract. There's been no direction for staff to ask for any additional funding. And in fact, there was discussions about the funding made available through Saban going towards the Healthcare in Action recommendation. So we would do a set of alternate recommendations to the commission. It is the commission's prerogative to put forward, separate recommendations from staff, and we would look to do that because we will not be asking for increased supplemental funding. So with that said, we would probably we would see which of these contract recommendations that you are, that you are in alignment with staff. We'd get those, if you approve those this evening, we'll begin working on those with the contracts and the scopes and the budgets. And we'll get those going and then take, though, for the ones that you would like to see different funding, different recommendations, we will take those to council September 19th with two sets of recommendations.
So staff will not be requesting any additional funding from what I just understood you to say, and anything that commission may or may not decide will be a separate recommendation, albeit it would be the commission's recommendation to council, and then staff would provide their recommendations. And I just want to say this out loud without prejudice, that are factually based and that are based historically, and goals have been set up. That is not there's no, don't take that the wrong way. I'm just making sure that I understand why staff would not ask for additional funds. And it is because of those reasons.
That is clear. So
Okay.
we, as I'm repeating myself, but I would like to, we made those recommendations, all of them, with the exception of Healthcare in Action. We were able to make the recommendations that we believe meet most of the priorities and also meet the additional funding as it was presented in the city's budget. So we did that, and there was a remainder before Saban turned back in their application. There was the remainder of $33,717, which we put towards Healthcare in Action. We knew that was the one contract that we were going to ask for supplemental funding. Saban turned in their application, and we dedicated those funds towards the Healthcare in Action. So we would maintain those recommendations. They're based on the history of service provision, including the recommendations that you've pulled for discussion. So, and that's, and that's fine as well. We can take two separate recommendations to council. It could potentially prolong the process, but then that leaves the decision for council.
Okay, if everyone would indulge me, possibly at this point, we could agree on some of the things, some of the providers that staff has done, and we can get those off the table and onto the side, okay? So, David, I want to know if this is legal, that I can just go through the ones that have not been touched, and we can make the recommendation to approve staff's recommendation.
That's
Legally,
correct.
this can be done?
Yes.
Okay. With my colleagues' indulgences, can we do that at least to get some of this off of the table? Does anyone have just not want to do that? Okay. All right. So everybody have their list in front of them. So we are all in agreement on staff's recommendations for Alliance of Housing and Healing. Anyone not? Okay. APLA Health and Wellness, anyone not? Okay. Essentia, anyone not? Please do not be embarrassed. If you don't agree, please say it. I'm not trying to push this down anybody's throat. Awakening, anyone not? Being Alive? Bethzetic? DCRC? Friends Case Management. Commissioner Byers, did you have your hand up? Okay.
Sorry.
Friends Case Management. Friends Research, HIV Ed. Friends Research Outpatient. Healthcare in Action, we have pulled at this moment. Hollywood Food Coalition, we're pull at this moment. Housing Works. Okay. Jewish Family Services. Let's do WHCSSC.
You want the, sorry, Chair, JFS Comprehensive Services Center?
Yeah.
Yeah, I want to pull that.
Okay, hold on one second, please. Freiberg. JFS Nutrition.
I'm going to pull that too.
Freiberg. JFS Sova. JVS.
That's
Did
pulled.
someone pull this? Did someone pull JVS?
Yes.
Okay. Who pulled that?
Pirelli.
Okay. LALGBT date rape drug kit. Did you pull that, Sam, or did you just make a comment?
Only a comment.
Okay. LGBT legal services, just a comment.
Only a comment.
LALGBT mental health, anyone? LALGBT senior services. LALGBT sexual health. LALGBT WeHo Life. I have Sam. Sam, I have you down, but was that a comment?
Comment.
LALGBT Center Youth. Maple Counseling Center. Men's Health Foundation. National Council of Jewish Women. Pathways. Planned Parenthood. Project Angel Food. Saban is off the list. Seeds of Hopes, this is pulled.
Jimmy, I'd rather not pull Seeds of Hope. I'd rather, I think I would rather see what Commissioner Byers brought up. And so I would like to leave Seeds of Hope alone as it is now, the way that staff has proposed it. And
Sam, did you pull Seeds of Hope?
no, he didn't pull it.
I'm abstaining anyway. From
Okay,
Seeds of Hope.
okay.
Yeah, so I would just as soon see Seeds of Hope stand as it is now, and go along with Commissioner Byers on the fact that monies that I was interested in could go towards the Hollywood Food Coalition.
I need to pull the city clerk in on this for a second, please. Once we approve these, we do not go back, correct?
Correct.
Okay, thank you. Step up on second. Tarzana. Trans Can Work. Trans Latin.
That's been pulled.
Oh, I'm sorry. I'm sorry, Sam. Was that you?
No, it's David.
But I pulled it.
Sam pulled it. Yeah, sorry. Okay. Dee and David, these are the ones that I have. I want to just double check or triple check. Alliance, APLA, Essentia, Awakening, Being Alive, Betsedic, DCRC, Friends Case Management, Friends Research HIV Ed, Friends Research Outpatient, Housing Works, Comprehensive, that's pulled. Nutrition is pulled. SOVA is okay. Date rape drug kit from the LA LGBT Center, okay. LA LGBT Center Legal Services, LA LGBT Center Mental Health, LA LGBT Center Senior Services, LA LGBT Center Sexual Health, LA LGBT Center WeHo Life, LA LGBT Center Youth, Maple Counseling Center, Men's Health Foundation, National Council of Jewish Women, Pathways, Planned Parenthood, Project Angel Food. Seeds of Hope is not being pulled at this point, or it is, Sam?
No, I withdraw my pull.
All right, I had Sam by that. I was blaming you, Sam. All right, so Seeds of Hope is okay. Step Up on second, okay. Tarzana, okay. Trans Can Work, okay. Trans Latin Coalition, okay. So,
just for clarification.
No to Trans Latina Coalition, sorry. They're pulled.
Yes, they're pulled, I'm sorry. All right, so we need to make a motion on these, David?
Correct, you need a motion, but I'd like a little clarification before you do.
Okay.
There is no recommendation for a contract with Friends Research for case management. That has been incorporated into the HIV Ed and into the outpatient. and there is no recommendation.
1 second. So that would be application 8, case management. Okay, and go on.
And there is no recommendation for the LGBT date rape drug kit. That's been incorporated into WeHo Life, into the WeHo Life.
So that is application 18. Okay.
I move that we approve these recommendations as listed.
I second.
Okay, can we get a roll call, D? D, do you have to say it? Do you have to say it in its completion? David, does it need to be said in its completion?
I don't mind repeating it for the record.
Yeah,
So that
I think that's safe to do.
Clear. Okay, so the motion on the floor is to approve staff recommendations for the following agencies: for the Alliance for Housing and Healing, for APLA Health and Wellness, for Essentia, for Awakening Recovery, for Being Alive, for Betsetic, for the Disability Community Resource Center, for Friends HIV Education, and for, and for Friends Outpatient, for Housing Works, for JFS SOVA, for JVS, yes. No.
I have JVS pulled, but
yes.
Okay.
I'm so sorry. Yes,
That's right.
yes.
That's right.
And then here we go with the center. Okay. I'm going to read them in order. For the LA LGBT centers. For the center's legal services, for the LA LGBT Center's mental health services, for the LA LGBT Center's senior services, for the LA LGBT sexual health, for the LA LGBT Center's, hold on, give me 1 second. I am just getting over. Okay, thank you so much. For the, did I say sex health already?
Yes.
Yes.
Okay. And for the LA LGBT Center's WeHo Life, for the LA LGBT Center's youth services, for Maple Counseling, for the Men's Health Foundation, for the National Council of Jewish Women, for Pathways, for Planned Parenthood, for Project Angel Food, for Seeds of Hope, for Step Up on Second, for Tarzana Outreach, and for Tarzana's treatment services, and for the nope, we pulled them. That's it.
You did include trans can work, correct?
We did not do a recommendation.
Not funding them, but do they need to be in the, we're not funding them, but do they need to be in this motion, David?
No, they do not. There's no recommendation for.
Okay.
Okay, so that is the motion on the floor for staff's recommendation of the approval of the aforementioned agencies. Roll call vote, starting with you, Commissioner Borelli.
Aye.
Okay, Commissioner Byers.
Aye.
Commissioner Darvish.
Aye.
Commissioner Davis.
Aye.
Commissioner Freiberg.
Aye.
Vice Chair Meltzer.
Yes.
And Chair Palmieri.
Yes, thank you very much, Dee.
Thank you.
Okay, now let's revisit. So I want to go to Commissioner Freiberg. You pulled comprehensive services and nutrition. Was that it?
And Hollywood Food Coalition, which I can start with if you want, since we were already talking about it.
Okay, 1 second. Okay.
So for Hollywood Food Coalition, after reading their proposal, like everybody else, I was really excited about the possibility of a partnership with them. It sounded like a match made in heaven, as their mission is directly in line with our clients, or with our city's climate action plan, which is to reduce greenhouse gases, decrease landfill levels, conserve water and natural resources, and support animal welfare. Over the years, they built close relationships with major companies like Bristol Farms and Netflix, who serve high quality gourmet food that's not only nutritious, but environmentally friendly and tailored to the needs of the nonprofits. They've been operating for 35 years. They've worked with 125 nonprofits, including our own partners, Essentia, JFS, Housing Works, Project Angel Food, and the Saban Clinic. But they were only able to do this because they were covered by a grant. So I find their proposal amount of $118,217 fair. It's cost cutting in kitchen and labor, and there's no charge for food. And I know our residents will love the high quality gourmet meals. So I would ask this commission that they be fully funded, because I could see them as a partner now and in the future.
Commissioner Freiberg, do you have a do you have a place where you want to pull that amount from?
No, I don't, because I really didn't know that I needed to find a place, to be honest.
Okay, so David, we're going to take each one of these and vote independently, each one, correct? Is that the legal way to do this?
You should do them individually, but you do need, if there's a recommendation for funding over and above, you do need to designate where you would like to take that from.
So just to revisit, Commissioner Freiberg, and this is certainly not isolating you. This is just one reminder for the commission. You need to have a reasoning, number two, a justification, and number three, alternate. I can't even read my own writing at this point. An alternate place to have an alternate recommendation for this amount. So what?
I mean, I guess I could suggest the Saban Clinic, since they pulled out. I mean, there's only a few left, right? Because we can't pull from anybody that's already been approved. Or we can go to JFS Nutrition Services and pull from there.
Okay, and your justification for pulling from JFS would be?
I could go over my comments about them if you'd like.
So I honestly, I'm truly interested in your comments under commissioner comments, but I'm just looking for facts at this point.
So these aren't commissioner comments. These are about the two that I pulled.
Okay.
So would be my comments on staff recommendation. Isn't that why we're here?
Yes. What I want to do though is to, I would like for the amount of money that you're looking for to make sure that we can get to some place and vote on it. So, and I truly am interested in your comments, but do you have some substantiation for this?
I just read my comments. I'm not sure what you're looking for.
All right, so David, how do we proceed on this? Does Commissioner Freiberg make a motion on this particular item and then we bring it to a vote?
Well, you definitely want to settle on the amount.
And that's 118,217, Commissioner Freiberg?
Yes, and I also
for the reasons that you stated?
Yes, and Commissioner Byers also had an amount, so maybe we could fit somewhere in between.
So Commissioner Byers, if I'm writing this correctly, your amount was 58,675, correct?
Bingo.
All right. So Commissioner Freiberg, your motion would be to split this to do 58,000.
I mean, I would love to see them fully funded.
Okay, so we need a motion. Can you, if you would like to make the motion, please do. If not, I can go to Commissioner Byers to make the motion, but I believe since you pulled this, you might want to make that motion.
I have a question though before we go.
Okay, Commissioner Darvish.
And my question is, I thought we talked about them and that they could continue and the city would collaborate with them. So are they not able to serve the city without this fund? Or I was confused there. So
okay, so as of last week, they were able to. As of this week, they're not able to. So that was a little bit confusing to me, but be that as it may, that's what was stated this evening. Commissioner Freiberg would like to see them fully funded at 118,217. Commissioner Byers, although I believe she wants to see them fully funded, is also okay with $58,675. But as Commissioner Freiberg, I'd like to offer you the opportunity to make the motion, if indeed you would like to.
I guess, I'm not sure how this, how this would work if somebody's.
I can step in here and if you'd
Please
like,
do.
Commissioner Freiberg, and suggest that we, that as a commission, we fund West Hollywood Food Coalition at the $58,000 some odd dollars that Commissioner Byers had originally pointed out.
Can I get a second on that?
A second.
Okay, so motion by Commissioner Davis to fund West Hollywood Food Coalition for $58,675. Second was Commissioner Freiberg or Byers? I'm sorry, I didn't see.
Freiberg is who I have.
Okay, Commissioner Freiberg, second. Can we get a roll call?
Before,
Or do we need discussion on this?
I just want to know where I don't know where the money's coming from, where that 58, could you tell me again?
Okay, so from what I'm understanding, Commissioner Freiberg would like to pull this from, and correct me if I'm wrong, Commissioner Freiberg, would like to pull this from JFS Nutrition.
Or so the way that, and I could be completely wrong, but just for the record's sake, the way that I have it noted, because we are going with Commissioner Byers' amount of the $58,675, that $58,675 is coming from the general fund amount to be adjusted from the Healthcare in Action General Fund. And that is the difference between what staff recommendation is for Seeds of Hope and the fully funded amount for Seeds of Hope that Commissioner Davis was requesting. Is that correct, Commissioner Byers? We were looking at pulling it from the general fund to make the staff supplemental ask for council to increase by that additional $58,675, taking it up to $462,188 and bringing down Healthcare in Action General Fund amount from the adjusted with looking at Commissioner Borelli's numbers. It's a lot of referencing and I do apologize. But looking at it after Commissioner Borelli's adjustment, bringing it down from the $152,680 down to $94,005.
Stephen, can you make your motion again?
Yeah, Dee did such a good job. I'm sorry. Very good. Thank you very much.
Can I just ask a question, a clarifying question really quick?
Yeah.
So the only money that we can take from is what's left over from the Saban clinic because they pulled out?
So as I understand it, Commissioner Freiberg, is that staff is not asking for any additional funding.
Right.
So we are trying our best to work with what we have. Certainly that doesn't stop anybody from asking anyone else for more money.
Okay.
Okay, does that answer your question?
Yeah, I just wish a lot of this was more clarified before, but okay.
Okay.
And what is it that I shouldn't even asking these questions, that I cannot follow this. And what is it that we have that we're pulling from?
So
I think Dee explained it very well, that it comes out of the total amount of monies from Healthcare in Action on the funded part that the city has already agreed to. And we would be pulling it from that and adding to the amount that the city has not agreed to, which is the supplemental amount, which is where Commissioner Borelli is pulling and where I would like to see pulled as well. So it's increasing the amount that we ask council for by, I don't know how much money because my head is beginning to burst here as well. And, but I do know that my request would be $58,000 and change. So that's what my motion is that we pull from the money that Healthcare in Action was to receive in our funding and move it to the funding from the supplemental funding.
Is that your amended motion? Motion? Is that your amended?
That's what my motion is, actually. And so that's where the money's coming from. It's not coming out of the air. It's definitely got a basis in reality.
And that was clear to everyone?
Got it.
And I think Dean did a very good job of explaining it. Again, I would like to commend him. Very nicely done.
So motion by Commissioner Davis, second by Commissioner Freiberg. Dee, can we get a roll call on this?
Absolutely.
David, is there something that you want to say? Because I could see that you want to say something.
Well, that would be, so we will have an alternate recommendation from staff.
Yes.
Because this would be adding to the request of additional unallocated reserves from council.
Yes.
So we're trying to work with the remainder, the funds from that are freed up from Saban, but we're not going to request additional funding from council.
Yes.
We were provided the approved budget, which was a little bit over $1 million. We've got the additional funds from Saban. So this would be an alternate recommendation from the commission.
Yes.
And I'm so sorry. Can you just repeat the motion before we take the vote?
Absolutely. So the motion on the floor, and Commissioner Davis, please correct me if I am wrong, but the motion on the floor is to fund the Hollywood Food Coalition with Commissioner Byers, your $58,675 adjustment, which will be pulled from our general fund, the extra money that went back into our budget from Saban pulling their application as a result, coming from the corrected attachment 2, which the commission received this afternoon for Hollywood, for healthcare. Oh my gosh, so sorry, for Healthcare in Action's staff recommendation now.
And I want to make a clarifying remark that I'm not amused by, I know it's kind of fun to poke at council, but this is an amount that we were allowed all these recommendations with an amount in mind, and that supplemental is coming from staff, not from the commission. And that if staff believes that this is something that council wants, then I believe council should pay for it. And we were not allowed that information while we went through all these recommendations. And so I was hard pressed to come up with any money for Healthcare in Action when I originally went through everything. So to me, what we're doing is saying, okay, the city council wants this, the city council can pay for this, in my opinion, entirely. But if we're only reducing it by a certain amount, then that's fine. I think that it's already going to go as a separate issue. I'm not trying to make light of what we're doing, but I'm also not wanting to make light of council and their persons. So that's the end of it. I would call for a vote.
Okay, thank you, Stephen. Can we please get a vote?
Okay, does everyone understand what the motion is on the floor and what we will be voting for? Commissioner Borelli.
You can call me Borelli. I'm hard pressed to vote on something when I believe Commissioner Freiberg has pulled JFS for 2 reasons, and not understanding if she's pulling them to change their numbers. If she's pulling them to change their numbers, then I need to understand that before I'm willing to vote on this.
I can comment. So I didn't know that we had to have exact numbers of what we wanted to pull. I didn't know that Saban was going to pull out at the last minute. I guess I just misunderstood the process. So I apologize to Chair Palmieri, but I guess I am going to have to make my comments under items from commission because I don't have a specific number. I didn't know I had to.
So then do you still want to pull the 2 JFSs, or can we move forward with them?
So what's the point of pulling it if they're just going to ask me for a number, which I don't have? I don't have a specific amount. I mean, for me, it's more of going through the contract. Like, I'm not an accountant. I'm not going to know exactly what, could be pulled from there. So I'll leave it at that.
Okay, so then it seems like we might be able to get JFS back on with the staff recommendation. And it seems like the 3 items we're discussing are still Trans-Latina, JVS, and Hollywood Food Coalition. That's correct?
I'm
Okay.
hearing you, but I think we have to make a motion to approve the J.
Yes.
Sure. I just wanted to make sure that we were, that it seems like we could put JFS back on and then just keep these, as Commissioner Davis pointed out, keep the additional ask that we're asking for at the general funds level, not this 6.378. So 6.378 at least is closer. We'd like to just redistribute. It seems like we'd like to distribute Trans-Latina, JVS, among what was originally there and make the difference up with Hollywood Food Coalition in the general funds amount, correct?
Okay, so we need to take a separate vote for comprehensive services and nutrition, correct, City Clerk?
That's correct. It is correct, Commissioner.
Okay.
Palmieri.
All right, so I'm just going to put a motion that we are in agreement and will approve staff's recommendation for comprehensive services and nutrition. Can I get a second, please?
Second.
Second by
Just to
yes.
be a pain in the tuchus, but I don't think we can have 2 motions on the floor at the same time. So either I withdraw mine and you, or we finish mine and then we go.
Okay, so I think we need to recall yours so that we can progress.
I'll withdraw my motion for now.
Okay.
Thank you.
Can we go on with my motion, second by Vice Chair Meltzer? Can we get a roll call, please?
Absolutely. So the motion on the floor is to approve staff recommendations for JFS comp services and JFS nutrition services.
Yes.
And Commissioner Borelli, sorry.
Aye.
Commissioner Byers.
Aye.
Commissioner Darvish. Commissioner Davis.
Aye.
Commissioner Freiberg.
No.
Vice Chair Meltzer.
Yes.
And Chair Palmieri.
Yes.
Okay, so with the motion, it passes, noting a no vote from Commissioner Freiberg.
Thank you. Okay, Stephen?
Now I would like to reintroduce my motion, but I don't know, isn't it just as easily to like put Commissioner Borelli's all 3 of them together, or is that not something Commissioner Borelli would like?
So who are you directing that question to? Commissioner Borelli?
To Commissioner Borelli.
Okay.
So just to clarify, we would like to, my motion would be to fully fund Trans-Latina Coalition with what they asked for in their RFP, fully fund JVS WehoWorks with what they asked for in their RFP, and then the Hollywood Food Coalition, I'm just looking for the number here.
58,675.
58,675, which is almost roughly half of what they asked for, actually, from friendly amendments from Byers, Freiberg, and Davis. Is that correct?
Yes. So
and then we would go to staff. We would go to. It seems like we would go to council with almost everything. The staff in agreement with the staff, except for these three items, and the difference is with healthcare in action making up the difference from the general funds. And I agree with Commissioner Davis. We're asking for the city to come up with those additional funds, since at least a week ago it was possible.
And I would second Commissioner Borelli's motion.
Motion by Borelli, second by Commissioner Davis.
Can I ask for a clarification?
Yes.
So I just want to be sure that I have the correct numbers. So you are proposing to fully fund Trans-Latina. So you are taking it from the 198,565 to 250,000.
Correct.
you are looking to fully fund, and G, if you could total these up, it'd be great. Fully fund JVS WeHo Works. So you are taking that from staff's recommendation of 143,233. Sorry. 158,692, the staff's recommendation. You're taking that up to 195,996.
Correct.
And then you would like to, the third is fully fund healthcare in action, but you'd like to ask for additional funds from unallocated reserves or to meet staff's recommended amount, because we did not recommend a fully fund it.
Oh, I'm sorry, not, I believe we're all in agreement with the staff's recommendation
Okay.
for healthcare in action. Is that correct?
For the amount.
For the amount that
Right.
the staff recommended, yes, not what they asked for.
And then the you would like to enter into a contract with Hollywood Food Coalition for $58,675.
On behalf of my colleague, yes.
Okay. And I would like to have a little bit more discussion about that if the commission's open to it. But with that said,
please,
I'm wondering what can we cover of those increases with the money made available through the withdrawal of Saban, which is the 207,702. What's left?
I'm not adding.
Hold on.
I'm sorry, Dave, is that you're saying that we're like $200,000 short of the 6378?
No, so I'm saying we have available to go towards these recommendations, 207,702 that was made available from Saban withdrawing.
Right.
I'm wondering how much of these proposed increases from the commission could be covered by that 207,702.
I think all of it would be.
That's where I was going with that. That's
right.
I can do the math now. So the difference between just to you, David, the difference between the staff ask for the Trans Latina Coalition and the new motion on the floor by Commissioner Borelli with fully funding of the 250,000 is a difference of $51,035.
Okay.
And then the difference between staff recommendation for JVS WeHo Works and the motion on the floor by Commissioner Borelli of fully funding it at $195,996 is $37,704.
Okay.
So
37,000 what?
$704.
Uh-huh.
And then adding in the $58,675 for the Hollywood Food Coalition. If I'm not mistaken, it should be 147,000. I'm so sorry, but I'll do this right now. But it should be 147,414. But let me just verify 51035 plus 37.
That's the number that I have 2D.
Oh, okay, perfect. So of the 207,000 and some change, David, with the motion on the floor, we would be using up 147,414 of those dollars, which will increase our supplemental ask from the 300,000 plus to $462,188. And it would bring the Healthcare in Action general fund amount down to $94,005.
So let's get a little clarification with that. I just want to make sure I'm understanding our numbers. So the proposal is to fully fund Trans Latina. So that increases the total amount by $51,035. The next recommendation is to fully fund JVS, which increases the recommendations by 37,704. Then the third recommendation is to enter into a contract with the Hollywood Food Coalition for 58,675. The total of those three increases comes to 147,414. We have available 207,702. It seems to me that you are able, with these recommendations, to cover these increases with the money available from Saban, with money to spare. So you're good and you've got more money to spend.
The best news.
Actually, oh, never mind. I didn't realize I was on. But I think that I'm certainly amenable to allowing the remainder amount to stay with Healthcare in Action, which is what I believe we've all kind of been headed for. So that would be, I think Dee said $95,000 altogether and $5.
$94,005. Yes.
So $94,005 would remain in the Healthcare in Action spot under what Dee's calling the general fund, and that the request for council to supplement would go up the amount that we're requesting for the other three.
It would sort of be somewhere between what originally we had last week and what was decreased
Which is
today. Correct.
less than what you had last week, but a little more. Than what you
Meet in the middle. Meet in the middle. Yes, that's the motion. Those are seemingly the number.
So then I need to ask staff what, where you headed with this?
Well, I still need clarification, because I don't think that where do you see with these increases, where do you see any need to reduce the general fund allocation for Healthcare in Action? You have got these increases, the three of them, covered by the money freed up by Saban.
Yeah.
You've got it covered. You don't need to take away from anything. And in fact, you still have $60,288 to spend without asking any more from council. You have not spent with these three increases, $207,702.
My understanding, I'm sorry, David, but my understanding was that the entire amount that Saban would have gotten went to Healthcare in Action on the out of the general.
Yes, yes.
So by us reducing that amount, we're increasing the amount that you're going to ask, or what we would like to see increases the amount that we do ask for council to pay.
Correct.
So in some respects, you get $60,000, I think it's, $94,005 extra towards Healthcare in Action in the regular funding, and not have to ask the council for that money.
Correct.
So we're not interested in spending the other $94,005. What we're interested in is only for those three organizations to fund them.
Correct.
Right, and you're correct, and the clarification, I needed that clarification.
Okay.
If
there's a time where numbers start going.
So I'd like to hear from staff on this.
So, once again, we had, reasoning behind each of the contract recommendations. I do want to touch base on the Hollywood Food Coalition. We did call out, and Commissioner Freiberg last meeting, Commissioner Byers today, we did call out, we would like additional food and nutrition services, and we would like additional food and nutrition and wellness services available to the larger community, not just, home delivered meals that we provide to residents. So we looked at the contract, the proposal in that frame. I had conversations, I did the site visit, I had conversations with Asher and his team about how could we potentially do some distribution that would be open up to the workforce. Could we work with Seeds of Hope that's already in Plummer Park and doing distribution to expand what they're doing. Here's here's part of the things that we think about as the, as the monitors with this program. This program is happening already. They are working with, well, they're working right now with Housing Works. They have relationships with others of our contracted agencies, but it's not a formal relationship like it is with Housing Works. So this is taking place without city dollars. I was concerned tonight when I heard from the Food Coalition that if they did not receive funding from the city, they would no longer serve the city. Really? I don't understand that, because are there other municipalities that are funding this and that's why they're being served? We were being served without the city dollars. And we have to take into consideration those factors. If we are getting the service without putting city dollars, then we want to focus the city dollars on the other services that we need to contract for. This was available to the community prior to this proposal. There are other organizations that provide this service. This is state legislation that is in place that mandates generators, what they're referred to as generators, to work with organizations like the Food Coalition to rescue food. We're all, well, I'll speak for myself. I'm with you that I like this idea. This does align Commissioner Byers and Freiberg, I think, with the city's core values and where we're moving. I'm in alignment with you. I have concerns about that this is happening already without the city funding. And then this is a technical issue, but we have to pay attention to this. We put, and this was referenced by each of the staff that spoke last week, and was referenced because I had this conversation with the Food Coalition. I said, it puts the burden on our providers. And they said, well, what burden? We're taking away the burden. We're rescuing the food. We're giving it to the organizations. How do the organizations distribute it? Because if it is donations of dry goods, say it's bags of dry goods, similar to what JFS SOVA gives out, do you have a distribution just for West Hollywood participants? West Hollywood over here, the rest of your clientele over here? If it's food that goes to Essentia that's provided as meals, because they do have meals that they rescue and provide, prepared meals, do you distribute to residents of Essentia that have been identified as West Hollywood, and you don't provide them to the others? We've had that situation. I'm not saying that it's not possible. St. Thomas used to do that. West Hollywood here, everyone else over here. So, but it does put a burden on the agencies that they work with. And in some instances, they will not be able to delineate. If it's, if it is resources that go into preparing meals, we're not going to expect to say, okay, well, that was generated from the West Hollywood funds. This was other funding. It's all going to be blended. We do look at that. We do look at funding that has to go to West Hollywood community members, and this appears to create some challenges with that. I'm not saying that it couldn't be overcome, but I do want to give you detail on why we did not recommend this. We did consider it, still like the idea of it, still would like to have a relationship with Hollywood Food Coalition, still would like our other organizations to know about this service if they don't, and to work with them or with the other organizations that provide the very same service.
So David, I just want to back up and say something about St. Thomas, because if you remember, the reason we stopped funding them, it was because they did not, were not just serving West Hollywood residents. They were serving everyone out of West Hollywood's bank.
It's difficult. And I don't even like saying it.
I hate saying it too, and I hated when it happened.
Yeah. But the fact is, we have to watch West Hollywood funding, and it has to go to West Hollywood community members. So it does place some burden on the organizations that will benefit from the food rescue. You are, and I do mean this. This is what this process is about. And I would understand it if you said, what, David, we still recommend it. This is the way the city should go. Figure out how to monitor it. we can't make that recommendation.
I don't think I would like to say that directly to you. And like, you figure it out, that's your problem. Because that's not really the way I look at it. But it is, I think, something that we need to do. This has disturbed me since the very beginning, that we were not putting any money towards a relationship, and we want to have a relationship. So I think that I'm not interested in making your life any more difficult than it already is. What I'd like to do is see that the city move forward towards something that could benefit our residents. And I do believe that we benefit not only our residents, but quite often we do not benefit people who are actually our residents. If we are looking at increasing the amount of food that goes to men and women who work in the city, I think that there's a way to distribute. Quite possibly, there's a way to work with the Hollywood Food Coalition to see if there's a way we can target that particular population. I think there are many creative things that we can be doing, and I'm not interested in creating a lot of work for you and your staff, but I am interested in seeing a relationship that has some bite to it. And when Commissioner Byers pointed out what I was doing, I was perfectly willing to, and we're funding about half, so I think that makes good sense. But again, please do not believe that I'm saying, well, now it's your problem, you figure it out, because technically that's not the way I look at anything. It is our interest in helping the city.
Can I make a comment?
Yes.
In an effort of fairness, I feel like, David, you're saying a lot right now that you didn't say at our last meeting. I asked about the Hollywood Food Coalition. None of this came up. And I don't think it's fair that you're kind of pointing them out and singling them out and not giving them a chance to respond. So is there a way that Asher looks like he's still here? Is there a way he can respond to what you said?
So, David, I have to ask the city clerk on this, because public speaking is over for this. So let me ask if that's a possibility. Is she still here?
She was asking us to ping her. I do want to offer a little information, in response to Commissioner Freiberg, and I agree, this is a lot, at this meeting, but that is, the meeting that we had on the 19th was to present staff's recommendations to the community and to then hold the public hearing to get their input. This meeting tonight is to answer commissioners' questions regarding staff's recommendations. So this is the time for us to give, more detail which goes into the recommendations, and that's what I'm providing tonight for Hollywood Food Coalition. I agree it's a lot of information at one time, but that is how this is set up. Last time, just a presentation, hear from the community. This meeting, answer your questions, provide our reasoning for the recommendations that we've made.
So David, I'm not sure that we can offer one provider another opportunity to speak and not all of them. So can you please weigh in on this? If indeed she's not here, I don't see her anyway.
I think that you should hear from the agency. I would want to hear from them.
Fine. Yeah. As long as it's legal. I just want everything legal and on board.
Yes.
I just have one question. This is a free conversation, right? I don't need to queue up the timer, or is this to be timed?
We're asking for clarification. It's not public comment.
Okay. Thank you, Asher.
So here's Cecil Pope has their hand up too now.
I saw that you did have your hand up. If you're still available at the computer. Okay,
yes, I'm here.
Perfect. Thank you.
So I know there were a lot of points raised. So I guess I can address them individually. I guess just to start, and my apologies if this was the impression that we gave. We are not proposing to stop serving any existing partners that we have, right? So Black Women Lead has been a longtime partner of ours and is funded by our other funding. And so we will continue that partnership. Additionally, Housing Works and Essentia, just taking Housing Works as an example, we have an existing partnership with Housing Works, but they are a citywide organization. And so our proposal is really to expand what we're doing and to bring on new partners in the city of West Hollywood, which right now as an organization, it's challenging for us because we've been in a position for most of our history where we tried to say yes all the time. But in the post-pandemic landscape, because this program did start during the pandemic, we are trying to ultimately create a sustainable program. So in order to grow the number of nonprofits we can serve, which would, because this funding was available in the city of West Hollywood, it presented an opportunity to do so. Hollywood Food Coalition does have a very long waiting list of nonprofits throughout the county interested in partnering. And so right now we're just making an evaluation to determine where to focus our limited resources towards that tremendous need. And our focus, of course, we've always wanted to partner with the city of West Hollywood. This is a conversation we started last year in 2021 before the funding cycle came about. And so that's what's motivating. So we don't want to give the impression that we will ever stop serving a nonprofit as just because we did not get this funding. It's in order to serve new nonprofits.
That's just not what I heard, and I'm not sure that's what was said.
Can you clarify, please?
Well, from what I heard, and correct me if I'm wrong, please, that you were not going to be able to serve West Hollywood if there was no level of funding. Now, I may have misheard. I don't think I did because I wrote it down, but I may have misheard, and I hope I did, but I'm not sure that I did because I wrote it down as it was said. And I think that's where part of this conversation is happening. And I think David brought that up, that really, is that what's happening?
So I'm looking at, so I pre-wrote my statement, so I'm just looking at it here. And it was to provide new services in the city of West Hollywood.
Okay.
I think all the nonprofits who have submitted proposals, right, there's kind of an expectation that in order to do the work, right, it requires funding because we do have staff resources, we do have gas, truck maintenance, et cetera, to run this program. So we're only talking about providing new services, which was the thrust of our whole proposal in the first place.
Okay.
I would tend to agree with Mr. Landau, is that that's not exactly what I heard. The way the chair and way David has presented it. What I heard was what he just said is that they would be unable to expand. So in order for them to expand, we needed to come up with some money that would improve the relationship that we have. So I'm not certain I heard it the same way, and I didn't write it down, but I did hear it the way he's saying.
If I could ask a clarifying question as well.
And then next, I think Commissioner Byers wants to speak.
Thank you.
Go ahead, Commissioner Byers, you should go first.
Okay. Thank you. I appreciate that. My question was with regards to the experience of working with Black Women Lead. It sounds like there's already an experience working in West Hollywood with a partner on the ground. And that sounded like it was some of the concerns that we had about how to navigate the onboarding and work of partnering with. And if that wasn't a concern, maybe we don't need to have that spoken to. I just wanted, I heard, in the public comment, the executive director of Black Women Lead speak to this as a value add to their work. And that sort of collaborative partnership seems like it's the answer to some of the concerns we had about how the food actually gets into the hands of community members of West Hollywood.
David?
Well, that was my follow-up question to Asher, is that how would the agencies distribute the food, distinguishing between West Hollywood community members and total project, or community members or folks outside of the city?
So really, like, each of our partnerships with a nonprofit is very, we like to call it a concierge service, right? It's a very specific partnership depending on the nonprofit, their needs, right? And so for this grant, we understand that it would require some additional, like other grants we have. We do receive federal funding, state funding, et cetera. And they have requirements. And so we would work with our nonprofit partners to meet those requirements. So if you wanted more details on how that would exactly play out, it would really depend on how the nonprofit structures their program.
That was my question. Thank you, Asher.
It looks like we have another provider asking a question at this stage.
I do want to clarify that that contract has been approved.
Just for historical reference on Jimmy, when the commission wishes to speak to an agency that's actually present, we are allowed to ask questions with permission of the chair. So we're not bending any rule there, but we would be bending it if we're wanting to listen to public comment. Public comment can come later in the meeting.
Okay, so I see a provider with their hand up. So are we looking at this historically as a public comment, or are we looking at this historically as a provider that wants to weigh in?
Personally, I would say it's a public comment. Okay. But again, I'm not the city clerk.
No, it's not.
I know that's who I was wanting to ask. Okay. So where did we leave off? What was on the table? Stephen?
According to the minutes, we are on Commissioner Borelli's motion to fully fund Trans Latina. And I do want to, just for the record, for Commissioners, Chair, Vice Chair, while the total amount has not changed, I do want to make a correction to the addition. Commissioner Davis, I'm so sorry. I sense the disappointment coming my way now, but I misspoke with my calculations. Trans Latina Coalition, that difference is actually 51,435. I misspoke and said that it was 51,035. And then the difference for JVS is actually $37,304, not $37,704. However, the other totals remain the same. And you all can, I see Commissioner Byers. Thank you.
Can you give me the 51,000 again? What was that?
Absolutely. For the Trans Latina Coalition, it's $51,435. That's the difference between staff recommendation and it being fully funded. And so it still remains the same, that $51,435 for Trans Latina, the $37,304 for JVS, and then the $58,675 for the Hollywood Food Coalition would still bring the Healthcare in Action to a general fund amount of $94,005, and it will increase the supplemental ask by $147,414 up to $462,188. All totals. 462,188. Yes. Okay. Everything else remains the same, but I did want it to go on record that those corrections had been noted in my notebook. And thank you to my fellow colleagues for the checks and balances. I appreciate it. And so back to what was at hand is what is on the floor according to the minutes. Commissioner Borelli's motion to fully fund Trans Latina Coalition and JVS WehoWorks, and to provide Hollywood Food Coalition with partial funding of $58,675. Motion by Commissioner Borelli, seconded by Commissioner Davis.
Okay. I had it in reverse. I'm sorry. Sorry, Borelli.
So can we call the question, or are you looking for a vote?
Yeah, let's do a vote.
Roll call.
Yeah.
Okay. Commissioner Borelli.
I'm sorry to do this, but I'll vote yes on Trans Latina, yes on JVS, yes on Healthcare in Action, but no on Hollywood Food Coalition.
I'm not certain you can separate them out.
Well, so hold on. Can you? Is she back yet? Because how do we separate these?
You can vote on these one at a time. That would be just fine. You've got separate recommendations for each of these.
Okay, so Dee, can we vote on each provider individually?
Absolutely. So let's start with the motion to fully fund the Trans-Latina Coalition.
Aye.
Commissioner Borelli, okay. Commissioner Byers,
Aye.
Commissioner Darvish,
Aye.
Commissioner Davis,
Aye.
Commissioner Freiberg,
Aye.
Vice Chair Meltzer,
Yes.
and Chair Palmieri.
Yes.
Okay, the commission moves. I'm so sorry, if you could just give me one moment to fully fund the Trans-Latina Coalition. And now we will be voting to fully fund JVS. Commissioner Borelli,
Aye.
Commissioner Byers,
Aye.
Commissioner Darvish,
Aye.
Commissioner Davis,
Aye.
Commissioner Freiberg,
Aye.
Vice Chair Meltzer,
No.
and Chair Palmieri.
No.
Okay, and this is JVS, and that's no from Vice Chair and Chair. And lastly, motion to fund the Hollywood Food Coalition, $58,675. Commissioner Borelli,
No.
Commissioner Byers,
Yes.
Commissioner Darvish,
Yes.
Commissioner Davis,
Yes.
Commissioner Freiberg,
Yes.
Vice Chair Meltzer,
No.
Chair Palmieri.
No.
Okay, 3 no votes. Motion passes.
Okay. So
Now the tricky one will be healthcare in action.
yeah.
Oh, yes, I do have to do. Okay, thank you so much.
I'm certainly willing to make a motion that we fund healthcare in action at the staff recommended level.
Second.
Okay. And just so that I know for the record, when you say the staff recommended level, we are including its entirety and not the general fund and supplemental fund, correct?
No, I believe, if I'm not mistaken, there'll be money coming out of the regular budget of the 63 blah blah blah, and then whatever the difference is from that to their proposal of 5 something or another. I don't have it in front of me because I have the
Okay.
I have the grid, not the.
Okay.
I can get there.
So what you're saying is
522, 476, is that right?
Yeah.
522, 476.
Yes.
Okay, perfect. And so final motion, well, not final, but the motion on the floor is to fund Hollywood, I am so sorry, to fund healthcare in action at staff recommendation of the, what did we say, 500?
556, 193.
Thank you,
I have
thank
5.
you. Perfect. At the staff recommendation of 556, 193. Commissioner Borelli,
Aye.
Commissioner Byers,
Aye.
Commissioner Darvish,
Yes.
Commissioner Davis,
Yes. Yes.
Thank you. Commissioner Freiberg.
Aye.
Vice Chair Meltzer
Yes.
and Chair Palmieri.
Yes.
Thank you very much.
So if we could get clarification on how much that increases the commission's request for unallocated reserves from the original request from staff tonight of 314,774. My calculations is that this increases that request to 462,188 because we just added 147,414 for those
Yes.
three. Okay. And then D, what does that, and I apologize because you just said it, but what does that reduce the approved general fund allocation to healthcare in action? What does that reduce to now? The difference?
$94,005
Okay.
from general fund. Are you okay, Commissioner Borelli?
Yes.
Okay.
So we're still at the 63,785.82, and then the general fund request is just under 100,000.
So general fund is it's that 6.3 million and some change, and that remains the same.
Yeah.
And then the supplemental, if you go to the bottom, if you're looking at attachment B, if you go to the bottom, the supplemental line is the line that will increase with the difference to bring healthcare in action up to staff recommendation, and that line will be increased from what you are seeing as $314,774. It will increase to $462,188.
Got it.
Which is the difference of fully funding Trans-Latina Coalition, fully funding JVS, and providing Hollywood Food Coalition with the $58,675.
Got it.
Okay. Are we done with this? Anybody? Anybody? Stephen, anything?
No, but one could certainly understand why Commissioner Borelli tried to table this next item simply because my head hurts.
Okay, so I think it was time sensitive, from what I
Yes.
understand.
I
Okay,
understand.
so for a new business, I believe Paige, is Paige in the room?
So
Yes.
before you move forward, I'm sorry, Commissioner Chair Palmieri, I just want to clarify, just so there's no surprises. So staff will have alternate recommendations for the three contracts that you approved for Trans-Latina, for JVS, and Hollywood Food Coalition. I just want that to be clear. So what we will do, because we are going to get going with executing the contracts tomorrow, because we have basically till the end of August to have all of these signed off and entered into the portal for finance. We have to do that prior to going to council. That has to be 3 weeks before the September 19th, the September 19th council meeting, where we will take these for their approval. So we will have alternate recommendations for these three contracts. We'll have those prepared to have two separate actual contract docs, exhibit A's, and scopes that will be provided to council on the 19th. I just want to clarify that, just so
everyone is clear on this. Everyone is clear. All the commissioners seem to be clear on this.
Great, thank you. And we do appreciate it. We appreciate your input, your work for this. So much appreciated, and we'll go to Kobe.
Excuse me. Good evening, everybody. Good evening, commissioners and chair, and David and Dee, and hi, Paige. Good to see you. I want to go ahead and share my screen, so give me one moment, and we're going to keep this very brief. All right. So thank you, everybody, for your time. My name is Kobe Wagman. I'm the Parking Services Supervisor. I'm here with Paige Portwood, the Associate Planner from Long Range Planning, to give an update on the WeHo Dockless Mobility Pilot Program. I'm going to briefly skip over this historical background. It's not necessarily relevant, and I could probably talk too long about it, but it's really just to show you that this has been a culmination of a lot of different things, ranging back to WeHo pedals in 2016. The Dockless Pilot Program operates under the guidance of long-range planning and parking services. So it has seen a few people, but currently Paige and I are co-partners in administering it. We share duties, and a lot of that stuff is delegated to various contractors and other partners of the city. So we use ABM, which is the city's parking facilities operator. They run all of our parking garages and lots. And they are contracted to help the city pick up and clean up wayward devices, working with the different companies when maybe they've misparked or they're noticing different types of negative trends. And they drive around Monday through, or actually 7 days a week, and they have a van, and they also have a phone number, and they're available to the public to respond to complaints or just concerns. We also use Populous, which is a data aggregator. They take all the information in from the different companies and they make it into a very easy to digest platform that Paige and I use to then look at different trends and analytics, and then come back to the different commissions and boards and council with our insights. And then we also collaborate with the sheriff's department and public safety in the form of enforcement and different types of field assistance. I've mentioned operators a few times. So currently the program has 3 operators. We have Lime, which is the white and green type of devices that you're seeing out there. They are allowed to have up to 150 devices. 125 of those are e-scooters. And then just recently they've added e-bikes, and they've been allowed to bring in 25 of those devices. Then we have Bird. They are a completely scooter driven company at this point. They're allowed to have up to 100 devices. And then Wheels, which are kind of the hybrid devices that have the seats, but they don't have like pedals like bicycles, and they're also allowed to have 100 devices. And then in addition, we currently have 34 designated parking stations throughout the city. We have 17 that are currently on street and 17 that are off street. They are identified with either rectangles and squares. You'll see stencils that say park here, and then you might see them also corralled with different types of bollards and signage that's going to accompany them. So the pilot started last July 1st. So we just hit our 1-year anniversary, and we've seen just over 250,000 rides and counting. We're averaging about 650 daily trips. And while the days that we see the most activity fluctuate month to month, our last check for June, the busiest days were Wednesday and Thursday, and the times were between 2 and 7 p.m. And we also identified that 84% of trips began and ended in West Hollywood, compared to just being a pass-through trip, which would start and end outside of the city, indicating that 84% of trips are associated with either residents, businesses, or community members in some form. The average ride is just under 1.5 miles, and the average ride is under 14 minutes. We just completed our first community survey. This ran for about 2 months, and it was pushed out via our own city social media platforms with the help of our communications team, and then each operator pushed it up to their community members. We saw that 48% of participants live in West Hollywood, and 36% of participants live and work in West Hollywood. And that culminates with 58% of participants believing or feeling that electric scooters should continue to operate in the city. So some of the perspectives that we gained through this survey is that the community, or the feedback that we received, is that they believe that the program provides more options for individuals to get around. We got a lot of feedback that they're a wonderful substitute for driving short trips, driving alone, replacing vehicle trips. And it also helps people that people in cities live without the hassle and expense of owning a car. But we also learned that a lot of the community feels that they're dangerous to pedestrians. And one of the largest complaints that we saw, and it correlates with what we see in our complaint feedback that we use, is that there's a lot of clutter. So a lot of the devices are left on sidewalks. They can be left in paths of travel. Sometimes they're left in the street, etc. So a lot of this information, while we knew about it, this was really important for us to really validate what we were seeing. So what's really one of our main focuses with this update is that we wanted to share with this group what our future plans are. And this is slightly in the past, but I did mention there are e-bikes now on the ground, and this was one of the main intentions of the original pilot program. And we finally were able to get a company to agree and provide e-bikes. So those were successfully launched on July 5th. We are also, and we have been working with the different companies around enhancing safety and technology. And this is also a really important focal point. And this is probably the time sensitive item that David was referring to, is that there's been a lot of focus and discussion around the safety of the program. Paige and I are making our rounds to the different commissions and different boards and headed back to council in September. A lot of it is about what are the companies and what is the city doing about safety. And Paige and I are happy to report that 2 of the 3 companies have been working on safety and technology updates since the start of the new year. 2 of them have been already testing out devices that are able to be remotely throttled when they are exceeding speeds, whether they're riding or demonstrating bad rider behavior, or they're operating on a sidewalk or another area that is not allowed. These are still limited in size, and the span of these devices is still being throttled by supply chain challenges and different types of chip shortages, etc. But we hope to have a commitment from the operators by the time we go back to council, where we can say with confidence that they'll be able to commit to a certain number of these devices in West Hollywood. And then in addition, we have recently been able to partner with Block by Block, who are observing and taking reports and possibly even helping us and support cleaning up and picking up wayward devices and devices that might be impeding safe pedestrian access. And as well with the Sheriff's Department, we're continuing to grow and develop our relationship with them. Some of the outreach items that we have been doing and we look forward to continuing to grow and expand on are the farmers market. We are going to be doing another community survey towards the end of the pilot. It's set to expire at the end of this year on December 31st. And then we're also taking station pulses, which are really field surveys at the different stations, and continuing to learn about the community and receive feedback on how to improve the program. And then Paige and I are working with long-range planning and seeing how we can help partner, grow the bike lanes and the different types of infrastructure that we know and we've heard that would improve safety and the efficiency of a program such as this micro-mobility pilot program. And then finally, the 2 of the 3 operators have made large strides with sustainability in terms of being able to develop swappable batteries, cutting down on the fossil fuel emissions required to go and collect devices and bring them back to charge. Previously, devices would have to be picked up in their entirety, brought back to some central warehouse or location, and then they would charge. Now devices can just be picked up, devices, batteries are just swapped out, leaving the device in the right of way and really minimizing the need for a large truck or a large van, and really being able to target the devices that need the most attention. And then some of our next steps, we are in the plans to develop in our 4th phase of growing the parking network. We have 34 stations, as I mentioned, 17 split in half with 17 on-street and 17 off-street. We are looking to continue to fill in the gaps in where these devices can park, and we believe that will continue to help clean up the clutter and provide users more organized methods when leaving devices when they're done with them. Again, I mentioned phasing in safety technology, utilizing the advances that these companies have made and making sure that they're brought to West Hollywood as a priority. And we have 25 e-bikes, but we're looking to continue to grow that, as that was the original intent of the pilot program, was the continuation or the advancement of the building off of WeHo Pedals, the previous bike share program. So we want to make sure that we continue to allow and provide bicycles. Paige and I are always continuing to explore emerging technologies and how we can adopt them in the city, continue with our outreach efforts. And then we are still receiving our results from the survey. While we have a good idea in general, we still have to go through and synthesize the results, and we will be providing an update to council with that in September. And finally, just some basic information on how to contact us. This is a pretty frequent question: is where does the public submit a complaint or get more information? You can send an email to permitparking@weho.org for a non-urgent issue. You can always use the city's official West Hollywood app. And then you can use the online services section of the city's webpage. And for urgent items, you can call this 213 hotline, and that goes to the Scooter Solutions team, which is run by ABM, the city's contractor that I mentioned previously. And they're out 7 days a week from 7 a.m. to 10 p.m. and typically respond to complaints within 20 minutes when they're not proactively roaming the city. And that is our update in a nutshell. I will turn it back over to the commission. Thank you.
Thank you. Can I have my screen back?
Yes, I can give you your screen back.
Thank you. Okay, are there any questions or comments from the commission? Commissioner Darvish?
Quick question. By the way, this is a great program, as you mentioned. I think Colby and Paige, great job. I just wondered about customers that leave these devices on the sidewalk or block access for handicapped, disabled, sort of access to sidewalk or to the street. Is there a penalty for those companies that are not managing sort of, I know it's hard to manage the customer's behavior, but it seems like the company is responsible at the end of the day for allowing it to happen. Maybe they're not having enough instruction on these scooters, and the customers just leave them on the sidewalks or block access. There's no penalty, or how do we manage that? It has gotten better, by the way. I don't see many of them on the sidewalk.
Yeah, great question. So there are terms of service in the permit, where the permits that are issued out to the different operators, where they're expected to collect devices that are parked in an offensive manner, such as blocking a crosswalk or an ADA access point. We as a city have recognized the challenges that it can be for these companies to get to a lot of these types of situations based on the size and the number and the volume of rides, which is one of the reasons we brought in ABM, and we've been trying to build out this network of stations. But so we have not yet penalized any of the companies. We've been trying to take a more collaborative and proactive approach, but there is a term in there where they are expected to respond when they've been notified within 2 hours, but ABM typically is the one catching it and correcting it right away. The companies also have the ability to revoke or penalize their own users, but that's something that the city does not dictate or currently does not interfere with, since it's not our business technically, and it's not we don't own the devices. We've simply allowed these companies to do business, but it is one that is definitely a comment and a suggestion that other commissions have provided us when we look to make a recommendation to council for when and if this program becomes permanent.
Thank you.
Commissioner Borelli?
Thank you. I tried to get this moved. So I'm a proponent of public transportation. I often use our commuter line. I am not a proponent of the way that this is processed in the city. As Kobe just pointed out, we pay government money to pay a private company, ABM, to remove these devices for other private companies, which should have the responsibility. So apoplectic might be a light word right now. It's astounding to me that there's just absolutely no accountability from the users. There's no accountability in the crosswalks and the sidewalks. I would just urge the city, as I had in public meetings, city council, et cetera, to have some accountability to the rider. And I saw there are some in there, $10, $25, not enough, $50 to start when it's an issue. It's good to know that there are some technology devices coming down the pipe that can help with the safety issues. Hopefully, one of those can be, we know that you just left it across a driveway, and your $50 will be charged immediately. As I've said 1,000 times from now and during my time on Public Safety Commission, I think of Yola, I think of Annie, I think of my friend Mikey, I think of myself, who has back issues and cannot move and lift these things, and especially when we're out first thing in the morning walking our dogs. I actually wish they would start earlier than 7 a.m. because many of us are out long before 7 a.m. when we're finding these things just littered throughout the street. So if that detection software can somehow be used, I would appreciate it. Of course, the complaints are low. People like to complain amongst themselves or to each other or on the WehoVille comments page. I'm glad to see that block by block can be helpful, and I really do hope the city leans into using those ambassadors to actually stop people. I'm not sure how that is going to work out, but I hope that works. I think my other suggestion is to paint the bike lanes, paint the lanes that they're supposed to use, make them colorful, purple, green, red. I see this in other countries and other cities, and I think that that's going to help direct regular bikers, these bikers, scooters, etc., to use the lanes that they're supposed to. And I feel like, as somebody who used to ride the bike quite a bit, the pedals quite a bit, I would feel safer in a bike lane if there was more attention paid to the bike lane, so that the driver sees this is supposed to be a bike lane. So those are my notes on that. And I wish you guys good luck, and I hope we can rein some of this in. Thanks.
Vice Chair Meltzer?
What Sam said, I think that you are looking for so many ways to find these drivers accountable. That's not going to happen. How many you're paying them, you're coloring things. It's not going to happen. I suspect the folks I've seen on the scooters, I've never seen anybody with a helmet, that's for sure. They're all very young. And I think that's part of the problem. I think there's absolutely no consideration for anybody else. I can't believe I'm saying this. I really can't. But I see bikes strewn across the sidewalk, anywhere, wherever I walk. I stopped complaining. I stopped sending pictures to the city because I got tired of doing that. But you have a lot of older people living in the city, not only people who are disabled, but a lot of older people. And I suspect that, there is absolutely no consideration. And I don't see how this can get better, quite honestly. I'm really sorry to say that.
Commissioner Davis? Thank you, Commissioner Meltzer.
I would just want to agree with Commissioner Borelli, Vice Chair Meltzer, completely. And I would disagree with Commissioner Darvish in that I've actually seen an uptick in the numbers of scooters left in my neighborhood. And in weird places, including the driveway. One morning, trying to get out of my own driveway, I have to stop the car, hope that the automatic door doesn't crush the car while I get the scooter out of my way. So it's I agree with the other two commissioners, and I'm sure you've heard enough complaints. But if taking pictures and sending them someplace would help, I'll be glad to take pictures and send them. So anyway, that's the end of my comment, but I wish you well.
Commissioner Freiberg, do you have your hand up?
Yes, just a quick comment. I'm sure you've heard this. I mean, anyone with a disability, of course, is going to have an issue with all these people on the sidewalk, but I think it's not so much about causing actual accident and knocking somebody over. I mean, just going by them really quickly, someone with imbalance issues could just fall right over. So, I mean, I'm sure you've heard all of this before, but I would be remiss to say it. So, thank you.
Any other commissioners? Commissioner Byers?
Oh, thank you. I wanted to just first say I am a scooter user and I feel that I'm a considerate one. And there's plenty of times that I walk outside and see the scooter has fallen down in the breeze and I quickly pick it up, and I do my best to pick it up every time. But I want to speak to some of the benefits of the program itself that I hope we can think about in long term. First, I experience the city as not being thoughtfully built for anybody but somebody trying to drive around in a car. And I think that's the major concern we all live with, but not everybody speaks to that concern when we talk about scooters. And so I feel very alienated as somebody who will continue to live carless in the city and wants to experience my life safely. But the conversation around safety wasn't really framed in terms of the safety I am choosing to experience or not on a scooter. It's framed in terms of everybody else who doesn't want the scooters to be there. And that's a challenge that I think we'll continue to experience so long as we're seeing this as a battle. I don't want to see this as a battle. I think this is the path forward. Micromobility, bikes, scooters, these things are going to be in our city. And so long as we don't have a city that's equipped for them, we're going to have challenges. Even if we had bicycles, personal bicycles, I wouldn't feel safe being on any street in the city that doesn't have a bike lane. And frankly, even the bike lanes are not accommodating. We know that there's vehicles parked in the bike lanes, service vehicles, personal vehicles, what have you. There's people dropping off goods to the businesses on the street, and those bike lanes are occupied constantly. There's just no end to that reality that I experience. I have plenty of footage on my film that I capture as I'm scooting around or using one of those fabulous e-bikes. And it's a real challenge. And I just want to emphasize that we have to speak about that part of the reality with this, because getting rid of them or asking people to not choose to use them, I would buy my own e-bike. I would purchase a regular bicycle on my own, risk having it stolen from my inaccessible carport where there's no place to park my own personal vehicle, which is why I'm so happy to have this sort of shared service. I just hope that we can emphasize the need for infrastructure, because if we all can't champion and push it, then we are asking people to risk their lives doing something that they don't have a choice to do except get around the city in the best way they possibly can. So I just wanted to say that. And then I was really excited to see in some of the data that was provided by the companies itself, I think it was bird only, and I would actually love to have this be a part of what the city asks for when we work with these companies. But the data that we have around how many car trips are reduced by the scooter usage, I saw 26,632 car trips are reduced by the use of these scooters. And that was just one company, Bird. That's tremendous. 10.27 metric tons of carbon was reduced because we're using these scooters and not vehicles. That's a benefit to the city. And I am not somebody trying to risk anybody's safety. I care so deeply about it and my own. It's frankly why I don't like to drive a vehicle. I feel safer outside of a vehicle. But I just want to contend with that idea that this is not something that we can have in a city. I think we have to pave the way for it. And so I want to ask if we have a timeline for when we will have better bicycle lanes and infrastructure. I know that there's been studies being conducted right now on Fountain and Santa Monica. It's crazy to me. It's 2022. The city was built 38 years ago and we haven't built bike lanes in those places, but we've got to start somewhere. So if you have an update on that timeline, I'd love to hear it. And then if you could just maybe speak to the ability the city you may have to work with the other two operators, Lime and Wheels, to get more of that sort of data around how these are supplementing and offsetting our car usage and the carbon output from vehicles. Thank you.
Thank you, Commissioner Byers. I'm Paige Portwood, and to respond to your first question regarding long-range planning's timeline for the bike lane study, we are, in the beginning stages, so it's in the feasibility study stage, meaning that we are working with private consultants, engineers, to establish the tangibility of having bike lanes, because it's on these streets, and it's sort of complex just because of the streetscape and all that's required regarding the sewer, the width of the sidewalk, the width of the streets. So I think we should have a finished product of what we are able to do on those streets within the next year. As far as construction goes, it's up to the Transportation Commission, other commissions, and ultimately the City Council of what alternative they want to adopt for a future streetscape. So that might be 5 years down the line, to be honest.
Thank you. And then just the other question about our ability to work with the providers to get more information to communicate around the reduction in vehicular traffic and the metric tons of carbon. I thought was really interesting.
Yeah, we can definitely require that. Each of the operators submit a monthly report, and so that can be incorporated into that report that we receive.
Thank
and
you.
We will include that in the City Council update as well.
Thank you. I just want to say one more thing or add one more thing especially to my fellow commissioners. I felt really terrified about outing myself as somebody who rides a scooter, because I know there's a deep frustration with them, but I also just want to represent a part of the community that relies on that sort of micromobility and is doing my very own part to promote safety, to get off the sidewalks, to, put a helmet on, as Barbara spoke to, Commissioner Meltzer, and to do the right thing in this case. It is definitely a personal usage problem in so many cases. And it's an infrastructure challenge that our city has to contend with. So I hope we can all push against that reality too. Thanks.
Vice Chair Meltzer.
Commissioner Byers, I can't imagine you throwing your scooter in the middle of the street. I'm sure that you are absolutely a perfect person for this. However, it is my belief that even if there were bike lanes, whoever threw the scooter on the street would still throw the scooter on the street. I don't think the bike lanes would stop that from happening. I think there are just people who are like that, unfortunately. And no, you are not one of them.
Well, I certainly would take that picture in a minute, Commissioner Byers. So I would like to speak on this. I'm somewhere in the middle with this, because I don't like the idea that I have to see seniors on my block dance around, getting past some of them that are parked in front of my building, down the street, on the corner, never on the grass where they're supposed to park, always in the middle of the sidewalk. I walked, as many of you know, had surgery and walked with a cane for several weeks, and I had to move them, and they were problematic for me to move. They don't weigh 20 pounds. That being said, I also support the idea of scooters. But it is something that people have to take their own responsibility for. And by not enforcing any type of I don't want to say law, but by not enforcing some type of standard or safety standard, or enforce an age limit that is supposed to be riding, or enforce not more than one on each one, which I see continually, or on the sidewalk when they're grabbing bags off of seniors. And I've seen that 3 or 4 times. Speed by a senior, grab their bag and just keep going. And I've seen that at the Target shopping mall probably 3 or 4 times. So these become very difficult for folks with vision disturbances to navigate, very difficult for folks with mobility disturbances to navigate. There needs to be some accountability. I understand that they are going nowhere. I get it. And you know what, Commissioner Byers, I support your right to use it correctly, to use it safely, and to use it legally. There needs to be more accountability on this. And I don't mean just no. A $5 fine, a $10 fine, a finger wag, it doesn't work. This is a safety issue. This is conceivably hurting part of your constituency. So I truly believe, and I don't believe what Ms. Morel said way in the beginning, that, well, don't let West Hollywood be a blight. We need to have these. You know, the day after 200 of them were dropped off on our sidewalks, littered all over the place, and they didn't want to do any business with the city. They basically thought that they were going to do as they pleased. And I think a lot of us still have a taste in our mouth because of that, a bad taste in our mouth because of of how they responded. And I'll never forget, I remember Councilmember Heilman saying, what if a soda company dropped 500 soda machines off wherever they felt like in the city? How would we respond? So why we're not responding to keep these folks legal, I don't know. It seems that they are getting all of the benefit and not having any of the responsibility. I know you folks probably hear it over and over and over again, and certainly you're the sounding board, unfortunately. And no one is pointing a finger at you, but this is what we see, and this is the frustration that we deal with. I live on a block with senior housing, and I see people have to go in the street with their wheelchairs to dance around scooters that are parked in the middle of the sidewalk. And I can't tell you how many times I've had to move it in. And I don't say that to exaggerate. This is reality. This is what I see on my block. You know, at this stage of the game, we have pedestrians, we have skateboards, we have bicycles, we have everything on the sidewalk except circus elephants and tigers and everything else while we're walking. It's become, how do we navigate this? How do we get past the vegan restaurant that is basically, we have a foot and a half to navigate through? How do we get past this without getting hurt? Listen, I don't want to bring this back to myself, but I had to deal with this over the last couple of months. And I 2 times did get hurt in front of a restaurant that is basically taking up most of the sidewalk. So, you know, when you're listening to this and you hear frustration, it's real. We're not exaggerating. It's not like I've seen 1 or 2. I've seen it constantly. I'll probably go walk my dog tonight and there'll be 2 in front of my building and I'll have to move them to the sidewalk. Commissioner Byers, I absolutely wish everyone was like you, because I know that you probably are doing the right thing and trying to navigate this yourself. I don't drive either. So that's my rant. And I'm so sorry that you came after funding, because my head is splitting and I'm even more stressed, but thanks for coming anyway.
Thank you.
Anyone else?
Thank you. I think I speak for Paige, and I'll let her, I guess, speak for herself. But we really enjoyed, we were talking and we really enjoyed the conversation. I know I learned a lot about your commission and the complexities of everything that you deal with as a group, and I'm just really impressed. And so just on a personal note, thank you for having us. And this has been really excellent feedback. I walk through, I'm not blind. I see the challenges that you're sharing. We do hear it a lot, and we do know there's definitely merit there. And I just wanted to reiterate that this is a pilot, and we're taking all of this feedback to make and incorporate it into a better program, should that be what we're directed to do. And accountability and safety is at the very pinnacle of our priority list. So please, just if there's anything, while we can't go out there and have people park better right away, it is something we're working on. And your feedback will not be lost on us. And then I just wanted to make 2 quick comments just to make sure that everyone has the right information. I know you may see a lot of riders without helmets. The state actually has a vehicle code. You only have to wear a helmet if you're under the age of 18. And you can ride the scooters as young as 16, and the companies do regulate the age. Now, whether or not someone signs up using someone else's account or driver's license, that is something obviously that is more difficult to control, but there is some elements of regulating who can get access to an account. And then the helmets are something that really most people aren't required to wear them unless they're under 18. Paige, I don't know if you have anything else you wanted to add, but thank you.
Thank both of you very much. Okay. 5, nothing on excluded consent. Number 6, items from staff. David, do you want to start?
We just have one item tonight. Derek is going to provide an update.
Okay.
Sure, this is just a quick monkeypox update. So the Los Angeles County Department of Public Health and the Centers for Disease Control and Prevention are tracking monkeypox cases in the region, and they're working to respond to the current outbreak. The city is in the jurisdiction, as you know, of the County of Los Angeles, and the County of Los Angeles Department of Public Health, and the city staff are in contact with officials from Department of Public Health. At this time, the monkeypox vaccine supply remains limited. The county is working with the federal government to acquire additional doses, and they anticipate more doses arriving soon. Vaccine eligibility requirements are listed on the county public health website. There are instructions there on where to access the vaccine for those who are eligible for it right now. And for more information, you can visit publichealth.lacounty.gov. There is a monkeypox link right at the top of the page that you can click on to see the eligibility requirements, and then also what to do if someone does fit into those eligibility requirements, where to go to get a vaccine or how to sign up. That's it for me. Thank you.
Thank you very much. No one else?
That's it.
Okay. Do we have any other public comment?
No, Chair. It's just a few people left in the meeting now. If anyone remaining would like to just speak general public comment, please feel free to raise your hand at this time to do so.
Okay.
No, we're okay.
Thank you. Items from commissioners. Anyone? Commissioner Davis.
Really, really quickly, I would like to thank the staff for all the work that you do, for all the years that you've been doing it. And there is a lot of work that went into what we look at and how we go about doing the business for the city. So I just wanted to make sure that the staff definitely knows that your value is like thumbs up. I said once a long time ago, I don't know if I've said it lately, but I sleep easier at night knowing that you all are there. And I think that's the best thing you can possibly say about the group of people. And Dee, excellent work tonight. I'm really proud of you for all the numbers. That was amazing. So
amazing.
Amazing that you were keeping track of something we weren't very good at keeping track of ourselves. But again, I want to thank you all very much, because it is a lot of work and this is a long process. And I'm hoping that we did not disrespect you in any way. Okay, so anyway, have a good night. Thank you.
Thank you. Commissioner Borelli.
Oh, Borelli. I'll second that, staff. Awesome. The two special shout outs, Katie, because I believe this is her first go round. And again, to Dee, because I too have been so impressed, Dee, through this whole process. Really, and then really, I just my colleagues here, good work. This is probably one of my 3 now. This was probably the more challenging one, although we didn't have a 9.5-hour public hearing, so we have that to work with to go. But my brother, our commission chair, I mean, these are challenging to do already. To do them virtually. I think you and Dee have made an amazing team, and kudos to you for leading us through this challenging process. Yeah. Good job.
Yes, you were great, Jimmy.
Thanks.
You were.
Any other commissioner? Commissioner Freiberg?
It's literally my bedtime.
Sorry, I got to go through my comments that I was going to say earlier. But first, I want to thank staff for everything that they've done. And Dee, you did an amazing job tonight. So I really appreciate it. The 2 things that I just wanted to make quick comments on, and I'll fly through this, with JFS Comp Services. I had concerns with this proposal. The program will cost our residents $1 million a year for service, and the majority of our residents don't qualify for their services, as they only serve people 55 and over and people with disabilities. They also only reach 25% of their mid-year goal. Many of their services overlap with our partners, and the majority of their clients are only intermittent service referrals that the city could handle. They're also asking our residents to pay $664 a year in salaries, many being full salaries and not including the $60,000 receptionist salary that city council already approved for Plummer Park. They also are including $120,000 in indirect costs. I don't believe our residents should pay for their employee benefits, HR department, communications department, and their public policy agenda. So the question is, are our residents getting their money's worth, and is it a reasonable ask? So I hope that city council takes a closer look. As for their nutrition program, JFS nutrition program, they're requesting $600,000 a year to provide meals for 55 and over, and people with disabilities, another service the majority of our residents don't qualify for, as well as anyone on a vegetarian or plant-based diet. I'm concerned about the price of their meals, which is $12.83, and for-profit meals are half of that, and some even give discounts for older adults on a fixed income. When asked if JFS would consider using a lower cost supplier, they never answered, so I assume the answer is no. This is the second most expensive proposal that most of our residents are being asked to pay for, and only a small population can use. So I hope City Council takes a closer look and see if they can bring any costs down. And that is it. Thank you very much.
Thank you, Commissioner Freiberg. Anyone else? Okay, I just want to thank everybody. This was certainly challenging, not for many reasons, but I'm really, really tired, but I do have to thank staff, particularly for the extra amount of time that you spent with me and with Vice Chair Meltzer in making sure that we could try to get this covered with some semblance of normality. But we don't always, I want to say this because this is like the fourth or fifth that I've been through. We don't always agree on everything, and commissioners don't always agree with each other either, but that's what part of this is about, is having the discussion, bringing it to the table, and maybe hearing something that you didn't understand before or that you didn't agree with before. And I will tell you tonight, two things I didn't agree with, I am entertaining in my head tonight. And that's to someone's credit for explaining it. I also, I think what we offer as a city is unparalleled to any other city. And I talk to my friends that live anywhere in California, and they cannot believe what we offer. They can't believe the amount of money that we are allocating. And, I'm proud to be part of this process. It is a hard process. It's a lot of work, but I'm really proud to be part of it. And it's why I chose to be on this commission so many times to ask to be reappointed. I enjoy it, and I like watching where the money goes. And I like seeing the success stories of our providers. That being said, I think we're done tonight, and I don't want to see any of you till like October, maybe. Chelsea, maybe I'll see you zoom by a scooter. I don't know.
Motion to adjourn.
Dee, thank you so much.
Thanks.